Hello, 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 my friends. Jill Osborne, Interstitial Cystitis Network. It is the last Sunday of IC Awareness Month, Sunday the 26th, and it's time for another support group meeting. I'm just trying to get my stream set up here. Facebook is being funky. There we go. There we go. All right. So my purpose in doing these meetings, hi Barbara, is to make you so strong, so knowledgeable, so informed that no one can mess with you again. I don't want anybody to be able to tell you that this is all in your head. I want you to be able to be strong, confident, informed, all those good things. Because seriously, the ages of mansplaining and all that other stuff is over now. We are strong, independent women and men. We are assertive. We are educated. And we are entitled to good care. Hi, Jessica. Hello, Barbara on YouTube. We're simulcasting live on on YouTube, which is when I'm looking here. And if I'm looking over here, I'm looking at Facebook. All righty. Hello, Jessica. Hello, Jennifer. How are you, hon? Hi, Caroline from Dagenham, England. Yes. I just volunteered to do the Israeli IC national group. It just asked me to do an event, which we're going to do. Hi, Lisa. Hi, Michelle. Hi, Kathy. Hi, Sylviane. Hi, Karine from Belgium. Hello, Cindy. Linda says, just found out I have a 4-centimeter cyst on my left ovary. Any relation to urethral pain? No, probably not. Probably not. I mean, I went through many ovarian cysts when I was in college, and my ovarian cysts hurt when I moved. If I went from sitting to standing or standing to sitting, I would get a really sharp pain. And it just kind of throbbed, but I didn't have any issues with, I'm a little flustered here. I didn't have any issues with bladder pain at the time. I had more issues with just movement driven pain. I remember when I was in college and I ended up having to fly home, I knew there was a problem when I went from sitting to standing. Hello, Donna. Donna, thank you so much. Donna, you guys, where does the IC support group leader go to support? We can back to you. And Donna let me cry on her shoulder earlier this week, and I'm so appreciative of you, Donna. Thank you so much. IC sisters forever. All right. So, can anybody recommend a urologist that specializes in IC in Louisiana? If you hang around towards the end of the meeting, I will go through our list and I will help you. So, when I do these meetings, normally I do a 30-minute lecture, then I do 2 hours of questions. We might do a Zoom, et cetera, et cetera. Always know that I have got elderly people who are call for me frequently. And so if I hear one of them, which I do right now, I might have to go check on them real quick. And then we will come back and do potentially more. So give me one quick sec because I hear my mom. Give me one quick sec. She's 92. Dad's going to be 99 in a month. Hold on. All righty then. All is well on the home front. Whew, but very, very busy. So I want to talk about 2 things before we start taking your questions. Okay. So one of them is slightly embarrassing, and the other one is a gentleman I was working with on Friday. Thank you, Donna. Thank you. So, I have no shame. I will pretty much talk about anything. It's pretty hard to embarrass me about anything. So I woke up a couple of mornings ago with this really weird skin pain about 2 inches to the left of my rectum, right? So it wasn't in my rectum. It was like a couple of inches away. And I was just moving around going, what on earth is that? What is that? So I went and got a mirror looked at it, and I had a little cut. I had a little cut on my skin. And you know, it was throbbing. It was like, you know, your skin down there, it's really, really tender. And I'm going, "What the hell is this? What is this? This is so weird." And then I was like, "Oh, wait a second. I have a padded toilet seat." And it tore, little tiny tear, and the little piece of plastic that's sticking up, really, really sharp. So I realized it was from my toilet seat, which I have now reordered. I really like the slightly padded ones rather than the hardwood ones because my muscles have been so sensitive down there. So that's what I do, right? That's what I do. Anyway, so it's like, okay, mystery solved. I know how I got the dang cut, right? But it was really throbbing. I mean, it was like, oh, wow, this sucks. It's almost as painful as hemorrhoid pain, but it wasn't hemorrhoid pain. And I was just kind of doing my thing, and it wasn't stopping. And then I started getting bladder pain. And then I started getting muscle pain all in my pelvis. And before I knew it, I was doing the IC walk. Y'all know the IC walk, right? Here, hold on to me. Where you're walking around like this, right? So like, you know, 30 minutes after this all this drama, I realize I'm walking and I've got my hands and I'm pushing over my belly, which is what I used to do. And it was a perfect example of nerve sensitization and a perfect example of neuro crosstalk. So we know we had research years ago which showed we called it the pepperoni pizza algorithm. I think the researchers actually called it that. Where if the bladder was irritated, the bowel would become irritated. If the bowel was irritated, the bladder would become irritated. Well, in my case, because my skin was irritated, and I have very, very sensitive skin down there anyway, everything's sensitive down there because I'm a redhead, it very, very quickly spread to other proximal nerves. So I went from having skin pain to having bladder pain to having muscle pain really in about 45 minutes. And then of course my muscles locked down. My muscles locked down big time. My muscles got really, really tight, and which is what your muscles do when you're in pain. And it was just such a good lesson for me yet again to understand that eh, fighting pain is like fighting a fire in a way. You know, you got to catch it when it's really early with as little medication as possible. But you can have little spot fires that it can grow, and it grows because other proximal nerves and other structures also get involved. So how did I get myself out of this flare? I got myself out of this flare with a quarter of a Norco, which turns the nerves off. Norco, you know, of the opiate medications out there, you've got a very aggressive medications like fentanyl, which have killed many, many people, time release medications like OxyContin. And then there are very mild opiate medications that only last for 4 hours or so. And I have learned for me that if I start feeling that more intense pain, and if I catch it really, really early with 1/4, I cut a Norco, and it's the lowest dose Norco in quarters. I was able to turn all of that pain off within an hour. And it was not mild pain. It was, if I had to rate that pain on a scale of 1 to 10, it was definitely a 5. It wasn't a 6. I wasn't at the point where I was ready to call a doctor about it because I could see what it was. I could see that I had a cut, and I knew that cuts would heal. But it had gotten all the other nerves down in my pelvis worked up, which again, I just thought that was really, really interesting. And I know not everybody has some Norco. The reason I have a little bit of Norco is because I've had to have a lot of dental work, and I have to have more. So I got to get to have a bone graft in a couple of weeks. I had a root canal that failed massively. And so anyway, I had a little bit left over for my dental work. And I just wish that patients had access to more pain medicine because I'm truly convinced that if I had not had that and I could not turn those nerves off at the spinal cord, that there's a very good chance that I would have been in pain for a couple of days, if not more. But that's just me. It's about learning your body. It's about learning what works in your body. And it was just a really interesting lesson in neuro crosstalk and nerve sensitization, right? Okay. And that's all been verified by research. Now, I want to talk to you now a little bit about a very nice older gentleman that I was working with on Friday. So he called on Friday, he was just absolutely despondent, in terrible shape. He'd been in pain for 4 years. He tried everything, nothing had worked. He didn't know what to do next, and he was just very despondent. And so as we start talking, because I really like to spend as much time as I can with men, because I think I've told this story many, many times, that the single most important phone call I've ever received from the IC network was from a man who was sobbing in pain. Like, I answer the phone, "Hi, Jill, IC network." And it was a man who was crying so hard, he couldn't talk for about 5 minutes. And when he did talk, he stunned me because he said, "I'm the chief of the biggest trauma unit on the East Coast, and I have IC and I have bladder pain, and I've told no one because the minute I tell them, I will lose my professional reputation and they will laugh at me because they believe that IC is mental and emotional." And he started bawling again. He started just terribly crying. He was so isolated and alone. So that was about 20 years ago. So I always make it a point to really try to spend as much time I can with men, because they don't necessarily get the same support that we women do. So anyway, again, I've got this nice older gentleman, 71 years old. He's had IC for 4 years, quote unquote IC for 4 years, severe pain, not responding to any bladder therapy. So we're just kind of talking a little bit here and there, It's like, okay, tell me what happened 4 years ago. When did your symptoms start? Can you remember any event that had happened? And he didn't really, he wasn't sure if there was a triggering event. It might have been, I don't think he fell, but there was some sort of initial triggering event, which was very mild. He didn't think it was a big deal, and it didn't sound like a big deal. So then we start talking about his symptoms. Like, all right, well, tell me about your symptoms. Like, what are your symptoms? And he goes, well, the doctor says I have IC. I'm just doing everything they do. And it's like, okay, no. Tell me about your symptoms. How are you sleeping? And he goes, okay, I'm sleeping fine. I don't get up at night. I'm like, oh, well, isn't that interesting? All right. Well, when is your pain the worst? Before you pee or after you're done peeing? When is your pain the worst? He immediately goes, afterwards. And I went, okay, what makes your pain worse? He said, sitting down. And I said, what happens when you stand up? Goes away. All right. Where is your pain? Sir, where is your pain? Tell me where your pain is. He goes, well, it's in my bladder. And I went, no. So I want you to put your hand over where your pain is and tell me where your hand is. And he goes, well, it's over on the right. And I went, oh, that's interesting. Is it just like slightly to the right of your center, or is it all the way over by your hip bone? He goes, is it by the hip bone? I was like, okay, so that's not your bladder, sir. That's not your bladder. So for those of you who have attended these meetings before, what were we able to isolate with those questions? Question number 1 is, do you sleep through the night? He said yes. Okay, IC, if somebody with traditional IC, Hunter's lesions, bladder wall driven, do not sleep well, that they're up every half hour, 45 minutes. He had no problem sleeping at night. Okay. Then the next question was, when is your pain the worst? Before you urinate or after you're done urinating? He immediately goes, afterwards. And I said, well, sir, then that tells us that your pain is not coming from your bladder wall. Because if your bladder wall was injured, your pain would be worse as your bladder fills with urine. And as soon as you emptied your bladder by peeing, you would feel better. So most IC patients feel better after they pee. He felt worse after he peed. So it's like, all right, so that tells me that your bladder wall is actually in pretty good shape. But now let's think about where your pain is located. And I said, now imagine a line going from your belly button straight down to your pubic bone. Your bladder is immediately above your pubic bone and slightly behind and above your pubic bone. Okay. Is your pain in the center at all? He said, no, it's over on the right-hand side by my hip bone. And I went, again, sir, that's not your bladder. He goes, really? And I went, no, that's absolutely not your bladder. And then I said to him, I said, okay, if you touch it, is it tender? And he goes, oh yeah, man, it really hurts if I push on it. It's like, okay, so we've got to get somebody to look at that right side pain, because that could be a couple of different things. Number one, it could be your appendix, because your appendix is over on your right-hand side. Although the appendix generally hurts most when you release the pressure. His hurt the most when you pushed in. Or that could be a muscle point, right? That's a muscle attachment point there, where you got a lot of muscles there. Then it's like, all right, have you ever had sciatica? You ever had pain shooting down your leg? And he goes, oh gosh, yes, absolutely. And I said, okay, so what that tells us, and it's on the same side as his pain, is that you have tight pelvic floor muscles. Sciatica is a de facto diagnosis of tight pelvic floor muscles that are pushing on the sciatic nerve. Nobody had ever talked with him about muscles. And today, if you follow the American Urology Association IC guidelines, they're crystal clear. The muscles should be assessed at the very first appointment. They were not assessed for him at all. At all. 4 years. 4 years of throbbing pain on the right side. Obviously, that's probably not his appendix, although it certainly needs to be checked. And that's yet again an important example of how IC becomes a grab bag diagnosis. And for men, what happens is if you have frequency, urgency, pressure pain, many doctors will automatically go, it's got to be your prostate. And they will throw you on antibiotics if you're a man. And in fact, he had been on antibiotics for a couple of years. They never worked. If the antibiotics don't work, the next step that the urologists do for men is they throw them on prostate medication. So he had been on lots of prostate medications. They didn't work. And then you eventually get the lecture of overactive bladder. Oh, I hate to break it to you, sir, I think you've got interstitial cystitis. They throw the diet at them. They throw Elmeron at them, and they say, come back in 6 months. And his urologist missed several what I consider to be really, really important points. Now, listen, I'm not a doctor. It's not my job to get in between you and your doctor. It's my job to give you questions and get you back to your doctor, right? And so what I suggested that he do is that he go back to his doctor and he had to tell them that his pain was by his hip. Your pain is right here by the hip, and it's pressure sensitive. And that he sleeps through the night, and that he does not have pain in his bladder as his bladder fills with urine, that he has pain afterwards, that he has sciatica, that he has pain shooting down his legs. Oh, and last but not least, IC subtype 4, pudendal neuralgia. He has pain when he sits down that is released by standing up. So that is a real case example just from a couple of days ago of a gentleman who had been thrown into the fire of quote interstitial cystitis, and yet he lacked the key critical symptoms that we associate with interstitial cystitis, which is pain as the bladder fills with urine, difficulty sleeping at night, food sensitivity. He didn't have any food sensitivity. So, I mean, the good news here is that in 2021 is that we now know to ask this question. We didn't know to ask this question 25 years ago, 20 years ago, 15 years ago, even 10 years ago. It wasn't until 2008, which is 13 years ago, that we had our first research study that showed that muscle work could be very helpful. And that was the moment that the IC world was turned on its head, because up to that point, everybody was going bladder, bladder, bladder. And now we're going, oh, wait a second, muscle, muscle, muscle could play a role in this too, right? So anyway, it is an interesting case study, and that's very common for women too. We get that exact same experience with women. So one of the key questions, again, that when I work with patients, I really like to get through is, where's the pain located? What makes the pain worse? What makes the pain better? And are there any other interesting symptoms that are associated with that? And of course, the most important question is, do you have pain as your bladder fills with urine, or do you have pain after you're done peeing? That's really helps us know what's going on with the bladder wall, or at least gives us a clue that the bladder wall might be compromised or not compromised. Okay, it's really hot. I'm sorry. I'm very squirmy today, and I'm hot. Ugh, hold on. Oh, you know why? Because I didn't turn on my fan. It would help if I turned on the fan, then I wouldn't be all hot like I am right now. Okay. So anyway, that's my little blurb. Let me just say too, we are in the last week of IC Awareness Month. We are still taking posters and memes for our poster contest and our meme contest. You got 3 more days, 4 more days. And so the winners get a $100 gift certificate from Amazon. Second place, $50 gift certificates. Third place, $25 gift certificates. Definitely need more entries for those. Last call to send our press release to your local paper talking about COVID cystitis. Go to icawareness.org, where you can learn more about that. All right. And then, of course, we have IC 101, our new book that I've been working on this weekend, even more. We have a new foreword for the book. I'm going to be updating the book and doing a lot more case studies probably early next year. All right, well, let's take some questions. Hello, Cassie. Cassie, I'm in my first trimester and I've been having IC flares. My doctor told me to take azo during the first trimester. Is that all I can do? Having a really difficult time with this and so nauseous. Cassie, over on the IC Network website, if you go to icnetwork.org, we have a pregnancy resource center. And the pregnancy resource center goes through the only paper that has been published, which rates the safety of various medications on a fetus. Generally, the rule is absolutely no medications in the first trimester. And then the second and the third, there might be some options. Anyway, this is research that was done by Dr. Deborah Erickson at the University of Kentucky. So that data is all summarized over on the IC Network website. But I also, in our last magazine, where is it? Is it right here? Yeah. If you email me, Cassie, this is our summer magazine. We're already starting to work on the fall magazine. We actually have an article in here on pregnancy, managing pregnancy and IC. So Cassie, if you email me, icnetwork@mac.com, I will definitely send this to you. Absolutely no charge, so that you can look through this. I would be a little concerned about the azo, to be quite honest. Azo has a new cancer warning on the new bottles. Look at your bottle, see if it has a cancer warning on it. I would be a little uncomfortable using that in the first trimester, to be quite honest, but this is something that you're going to have to talk to your doctor about, okay? A little more info. I had bladder spasms seen on cystoscopy, and I'm very, very careful with diet. The one thing that I think might actually be helpful, honey, is going to be chamomile herbal tea or peppermint herbal tea. We had a research study that was published that showed that patients who drank a strong cup of peppermint tea before having colonoscopy had far fewer bowel spasms. Because it's a smooth muscle relaxant. And so we think the same thing happens in the bladder. So I think I would maybe try to up your chamomile herbal tea and your peppermint herbal tea, okay? All right, let's look at Facebook here. Linda says, just found out. Okay, so we did the urethral thing. The ovarian cyst. Okay, Pamela says, I had a doctor and women both said I was mentally messed up. Oh, honey, that happened to all of us. That happened to all of us. My very first appointment in 1993, no, 1992, my doctor referred me to psychiatry, even though, even though he absolutely diagnosed IC within a week, So, and even when I was in 7th grade and I had my first symptoms of frequency, urgency, and I couldn't sit through class, the urologist at that time suggested that. And that this all goes back to a research study. So understand, in the history of the IC movement, IC was originally discovered or documented first in a medical publication in England in the middle of the 1800s. You go back and you read that original definition for IC of frequency, urgency, pressure, pain, obviously using words from that time, it matches today perfectly. So it was first studied in the middle 1800s. Then in the early 1900s, when they invented the cystoscope and they could look in the bladder, Dr. Guy Hunter was one of the first to find Hunter's lesions, which is why they're called Hunter's lesions, because he's the guy who found them. They were named after him. Then, in the 30s and 40s during the war, we had research that showed that this didn't just happen to women, that this happened to children, and this also happened to men. And unfortunately, in the 1950s, two arrogant pricks of a doctor published a case study of a woman in which they suggested that she had, quote, unexpressed anger manifested in the pelvis, and that she was mentally ill, and that was why she had all these urinary symptoms. And tragically, from that moment up until really, I'm going to say 1980, medical schools taught doctors that this was mental and emotional, despite the fact that our own National Institute of Health was already investing tons of money and had clearly established it as a real health condition. Dr. Dan Brookoff, who was our national pain leader for IC many, many years ago, God bless his soul, we did lose him a couple of years ago, was one of the absolute leader in pain care for IC patients. And he was actually a doctor who worked with cancer patients, and he had the sister of a cancer patient come in with a sister and about the cancer pain. And the sister who didn't have cancer said, can you please treat me? I have IC. And he said, no, IC patients don't have pain. And he was like, yes, sir, I do have pain. And he got very interested in that and started studying on that more. And when he came out to California and spoke at our pain conference that we did, he told her story. And he told a very interesting story about how he was introduced to IC in medical school. So when he was in medical school, because he was originally an internal medicine specialist, they had a one-day workshop on urinary diseases. And literally, as the speaker was packing up to go at the end of the day, he goes, oh, I should tell you about one more thing. It's called interstitial cystitis. These patients will drive you crazy. All they're going to do is ask for pain medicine. And they're just going to be the most annoying patients you'll ever have in your clinic. Basically, that was the message. And he didn't really provide any more information. And so another student raised a hand and said, what do you do for them? And he said, well, we remove their bladder. And then another patient said, but why would you remove their bladder if it was a mental and emotional disease, right? And Dr. Brookoff was like, yeah, that did not go well for that speaker, who apparently ended up becoming a very prominent IC researcher. I never learned who it was. So anyway, we're long past the days now of thinking that IC is mental and emotional any way, shape, or form. A mental and emotional disease is not going to cause Hunter's lesions. It's not going to cause chemocystitis, not going to cause tailbone injuries, things like that. And the only context in which we're going to be looking at the brain is in patients who have chronic overlapping pain conditions, where we're looking at a central nervous system maladaptation. And we are certainly not calling that a mental illness. It is absolutely not a mental illness. So, but can having pain that's untreated and having people tell you it's all in your head make you extremely angry and frustrated? Yes, absolutely. Anne says, is estrogen safe? Is it something to do forever? And topical estrogen, it's an estrogen cream that you could use on your vulva, at your urethra, and your vagina, is considered remarkably safe because it stays in that skin. It is not distributed throughout the body. It does not penetrate into the blood vessels where it's distributed throughout your body. It tends to stay quite localized. So I would encourage you to Google topical estrogen safety so that you can look at that research. Oral estrogen is another story because when you take estrogen by mouth, it is absorbed through your stomach wall, where it is immediately absorbed into your bloodstream and sent throughout the body. And so it is oral estrogen that is, in fact, more linked to cancer, like breast cancer and uterine cancer and ovarian cancer. Whereas the topical estrogen tends to stay in the skin, and they consider it remarkably safe. But you don't have to believe me. Google it, topical estrogen safety, and take a look at the research studies. Corrine says, my professor wants to remove my bladder and make me a neo bladder, a new bladder. Okay, so that's rarely done. That's a step 6 treatment option. The only time we really ever look at removing the bladder is if that bladder is shrunken. There are some bladders, for example, that are just filled. They're just filled with scar tissue. Remember, your bladder is like a balloon, right? And so as it fills, it gets bigger and bigger and bigger and bigger. And that's one of the really interesting biological mysteries of the bladder is, how does that happen? Why is it so flexible, and what actually makes it stretch and contract? I mean, really interesting biological mechanisms happening there. But if your bladder has been scarred by repeated UTI, or scarred by fulguration, or if you've had some sort of traumatic injury and your bladder has gotten very, 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 very small and it cannot stretch, so it's like the size of a walnut, that's really the context in which they're going to start thinking about doing a bladder augmentation, where they take a little piece of your bowel and they attach it to your bladder to try to increase capacity. Or in some cases, remove the bladder. Or I was just working actually with a friend of mine yesterday who was seeing Phil Hanno at Stanford University, who she said is now retiring and he's going to go somewhere. We don't know where he's going to go yet. He's kind of one of our experts. He's the top administrative researcher in the IC world. He's the chairman of the American Urology Association IC event, works very closely with the National Institutes of Health. So we definitely want to know where he's going because he's important. Anyway, he suggested to her that they just attach her ureters to leave the bladder in place, disconnect the ureters, and connect them to a stoma on the abdominal wall. And that would give the bladder a lot of time to rest and relax and potentially heal. So there are a lot of options if we're ever really looking at a very, very severe, severely scarred bladder. There's one other thing I was going to say there. No, the bladder removal is a very, very aggressive surgery. It is easily a one-year recovery. I was working with a patient last year who unfortunately had urethral cancer from HPV, the human papillomavirus. Hi, Kay. Nice to see you, hon. And because she had urethral cancer, they removed her urethra, her bladder, and they did a total hysterectomy. And then they told her she'd be able to go to work in 6 weeks, which is like, no. No. This is bladder removal is a major surgery. You're going to have help at home. It is a very slow recovery process. We have a bladder removal support board over in our IC network, on our IC network website, in our support forum that's moderated by a woman who had her bladder removed. So you can ask more questions there. What is Norco? Norco is a opiate. It's hydrocodone. It's either hydrocodone or I think it's hydrocodone with acetaminophen. Mary said, my doctor wants me to do bladder installations. She's doing heparin and bupivacaine. Anyone use this? Mary, that's called a rescue installation. It's definitely the most popular bladder therapy for IC subtype 2 bladder wall driven, most popular therapy around the world. Heparin will coat the bladder, and the bupivacaine or the marcaine or the lidocaine will actually numb the nerves in the bladder. And so we call this a rescue because it can rescue you out of a flare, and you might walk out of that office pain-free for a couple of hours. Eva says, oh gosh, my IC pain is so severe. The Norco I take is 10 milligrams and it barely touches the pain. Hi, Marie, thank you so much for the 100 stars. I really, really appreciate that very, very much. So Eva, number one, I am so sorry that you're dealing with severe pain. Girl, I feel your pain because I had severe pain for a couple of years myself that was not treated. I didn't even have pain medicine the first year, and it was bad. You always have to take, as hard as it is, because I know you're suffering. I know you're suffering. We always have to take a step back from treating the pain for a moment and ask ourselves what is causing the pain. Because if we address the cause of the pain, you won't need the pain care, right? And so the pain can be caused by basically 3 different things. The pain can be caused by something wrong with your bladder wall, like a Hunner's lesion. And in fact, for patients who call my office who are in severe pain, the great majority of them have Hunner's lesions that were never treated. Hunner's lesions are big bloody wounds in the bladder. And when urine gets on the wound, they hurt like hell. They hurt like hell. It's very, very severe pain. So somebody with Hunner's lesions, man, they're not sleeping at night. They might be down to eating 4 to 5 foods. They're certainly probably not going to be able to sit in a car without feeling pain. Working without pain would be very, very difficult. But when the lesion is treated correctly with lesion-specific therapy, like cauterizing the lesion, etc., the pain might actually go away. Hunner's lesions respond beautifully to lesion-specific therapy. So the first thing I would want to know, I would want to ask your doctor, Eva, is do you have Hunner's lesions? Because if you do, they need to be treated. And if they're treated, you might not need the pain meds, and it might dramatically reduce your pain. The second thing that we have to ponder, if the pain is coming from your bladder, is there something on a daily basis that is provoking your bladder? So as an example, there are 2 kind of, not horror stories, but they're good lessons about severe pain. So I had a husband call whose wife had very severe pain to the point that she was bedbound. And she basically had given up. She wasn't going to the doctor very much. She was just taking her pain meds. And so he called our office and he said, what can I do for my wife? I mean, she's suffering. I want to help her. And so we went over the whole thing, and we specifically went over diet. And he's like, thank you. And he took she wouldn't talk to me on the phone. So he took the information I gave him to present to his wife. And I didn't hear from him for, I don't know, 3 or 4 months. And he called back, and he said, she's so bad. Jill, she won't do anything. I don't know what to do. She won't even be a mom. She just literally just wants to be in bed. And it's like, okay, well, nobody wants to be in bed, sir. Let me talk to her. And he's like, she won't talk to you. And I said, I don't care. Give her the phone. Give her the phone. Let me talk to her. So I get her on the phone. I said, all right, honey, I hear you're having terrible pain. Tell me about it. So we go over it, very clearly bladder wall pain. And I say, now, but the severe pain that you're having, especially with her symptoms, pain as your bladder fills with urine, her pain was very severe when her bladder got really, really full. It's like, it really sounds like there's something on a daily basis that's really provoking your bladder. Are you following the IC diet? And she went, no. She said, and basically what it came down to, she said, I'd rather have my pain meds and my Diet Coke. So literally the only thing she drank was Diet Coke, and she took her pain meds. And of course, when you pour acid on the wound like that, when Diet Coke is devastating, anything NutraSweet based is devastating to the bladder because it is so corrosive and so irritating. She was just in this really bad addiction cycle where she was completely addicted to the diet soda. She was completely addicted to the caffeine, and now she was addicted to the pain meds. And she was never, ever, ever willing at all to even stop drinking the diet soda. And there was just no chance. So again, so we want to make sure if your pain's really, really, now I'm not saying you're like her at all. That was an extreme case. And it was a very, very tragic case. But we certainly want to make sure that there's not something on a daily basis that is really provoking your bladder, that's triggering all this severe pain. And then we also really want to look at muscles. We have to look at muscles. We've got to look at other structures. Muscles can hurt. Muscles can burn. And a lot of the pain and discomfort that I see patients have can be driven by muscles. And so I would want to know, have you had a pelvic floor assessment? So Eva, I'm going to make this offer to you too. If you email me, icnetwork@mac.com, I will email you our new book, IC 101, so that you can go through this and see if you can help understand what could be triggering the severe pain for free. Okay. Hello, Megan from South Africa, Johannesburg. I hope that you're having a wonderful day. Is it Monday there yet? I always get the time zones. I don't quite understand. I mean, I know the time zones. I just never know exactly where they are. So is the sun rising now? I think you're what? Are you 12 or 14 hours ahead of me? George says, feel so bad this past month. It is difficult to even post a comment. Urinating literally every minute. Urethra feels like ice. Oxybutynin causes retention. Aleve is no help, nor does Preleve, quercetin, glucosamine, or Rutin. Doctor only wants to see me once a year, claiming it is hopeless. I stay in bed 17 hours a day. Sleep is my only escape. I hope others can find relief that has eluded me for the last 45 years. Thank you for all your help. George. So hopefully you were here when I started this meeting, and I was telling the story of a 71-year-old gentleman who called, who was also struggling with very, very severe pain. The pain can be coming from your bladder, it can be coming from your muscles, and it can be coming from nerves. And this is the exciting thing about where the IC movement is right now. The IC movement is all about looking beyond the bladder. We now know that structures beyond the bladder can be causing all of these symptoms and quite a bit of this pain. So George, I'd love to talk to you this week if you'd like. I'd love to work with you a little bit and see if we can try to understand where your pain's coming from a little bit more, so we can get you back to the doctor and maybe talking about some other possible therapies. What was that? All right. You are not alone, kind sir. You are not alone. You are not alone. Hi, Ruth. Kayleen, I had my bladder installation on Friday. It went really good, even having so much pelvic pain. Then you had to go to Walmart to get your mom some foods because she just had surgery. I got so pissed off because they charged for plastic bags. I had to walk out to get bags, and oh, girl. Oh, no. Guys, Kayleen is reminding us of something that's very, very important. And that is, if you're having a bladder installation, do not try to go home with it, or do not try to stop anywhere. You're going to hold that installation at the doctor's office, sit in the waiting room, 30 minutes, however long they tell you. It's going to be, retention times vary. There are some doctors who say hold it as long as you can. Others will say 25, 15, 20, 30 minutes. Usually it's 15, 20, 30 minutes. So please, you just really shouldn't have tried to go shopping with the bladder installation. So your question is Should you call and get another one? Yeah, because it helped you at first. It did. Man, you just can't do that. You either have to go directly home, or stay there and pee it out and then go home. I tried to drive home once with a bladder installation on my bladder, and it was torture because I got stuck in traffic. So it's usually better to just chill out, bring a book, sit in the waiting room, do it there, sit in your car, and then run back in, use the restroom, and then go home. Okay. But I'm glad you tried it, hon. I'm proud of you. I'm really proud of you for doing that. Donna says, please do Zoom. Yes, I will. In about 25 minutes. Okay. Susan says, I'm having problems peeing. I feel the urge and then hardly anything comes out unless my bladder's really full. My doctor thinks Atarax may be causing the issue. I only take 25 milligrams, though, but have been using that since 2004. What do you think? Well, there are some medications like antispasmodics, which over time kind of deaden those muscles, and they absolutely can make it harder to pee. Atarax, not really one of those medications where it's known in the IC world to cause more urinary retention like that. Is it possible? Yeah, sure, it's possible. 25 milligrams is not the lowest dose. The lowest dose of Atarax is either 5 or 10 milligrams. So potentially you might be able to reduce that and talk to him about maybe experimenting with that. But honestly, I would really want to know what's going on with your pelvic floor, because it's really the pelvic floor muscles that are the most notorious for making it difficult to start your urine stream. If your muscle, normally when you urinate, it's fairly instantaneous. You sit on the toilet, a muscle relaxes, a sphincter opens, and you pee, and it starts within a second or two. If you're waiting 5, 10, 15, 20 seconds before you can release your urine, that usually means or often means that your muscles can be quite tight. Okay? So I would want to know what's going on with your muscles. Time for a pelvic floor assessment. Brandy says, I was diagnosed with IC and my pain is often worse after urinating. Recently, and a new symptom is retention. So again, Brandy, this is why we do something called subtyping, because we really no longer think of IC as an incurable bladder disease. We think of it as a pelvic pain syndrome. Why? Because structures outside of the bladder are often causing these symptoms. And so any good urologist at the very first appointment would do a pelvic floor assessment, or should do a pelvic floor assessment according to the American Urology Association IC guidelines. And so again, the fact that you have pain after urinating points us more a bit to muscle, unless you're having pain on your skin. If you're having what we call urine burn as you're peeing, your urine feels very hot, like it's burning your skin. That also could relate to estrogen atrophy, genitourinary syndrome of menopause. Kayleen says, I have a gyno appointment on Thursday and you're going to ask about pudendal neuralgia because you're having PGAD. Good. Tell them that you're having, one of the classic symptoms of pudendal neuralgia is something called persistent genital arousal disorder, known as PGAD, where it's a slight arousal sensation that is incredibly painful, and it is very, very disgusting to have this. And it's embarrassing. I call it one of the dirty secrets of IC. So I had it for about a month myself. And usually that just means your muscles are so tight and compromised, they're starting to squeeze those nerves down there. And so when we can resolve whatever's compromising the nerve, the pain usually goes away. Brandy says the only relief is Valium suppositories. Well, okay. So what does Valium do, Brandy? It's a muscle relaxant. So if using a muscle relaxant makes you feel better, then clearly the problem is with your muscles, right? Anne says, I'm starting estrogen. Is it safe? Yeah. Okay. We went through that before. And the answer is topical estrogen is considered remarkably safe. But Google it, topical estrogen. Oral estrogen can be a little bit more dangerous. Elizabeth says, I've been suffering for 4 years with IC symptoms with very heavy bleeding from endometrial hyperplasia, which I've had, uterine polyps, yes, which I've had. My pain was bad when sitting, much worse when standing. Oh, that's interesting. I just got the Marina IUD. I'm only on day 2, but oh my goodness, it's like night and day. I feel so much better, so much relief. Jill, you are so right about ruling out other major issues first. I know I have pelvic floor and pudendal nerve issues too, but the physical pelvic floor exercises have really helped with these. Good, honey. I'm so glad. I'm so glad. The challenge here, so Elizabeth, I mean, certainly I hope that you've been learning about endometrial hyperplasia. There's normal endometrial hyperplasia versus complex endometrial hyperplasia. Complex endometrial hyperplasia means that the cells are starting to differentiate, and these are the cells which could potentially lead to uterine cancer. So when I had my DNC, they found that I had complex endometrial hyperplasia with, according to Stanford University, who confirmed it, a vague architectural complex, which meant that it was just starting to build tumors, like just starting to build cancer. And obviously, in that case, we knew exactly what to do, which was an immediate hysterectomy. I had an emergency hysterectomy. Whew. Brutal. Megan, I started getting symptoms after I had COVID, constant cystitis, feeling of wanting to urinate, weird feeling on the urethra and burning. Prior to this, you'd only had one UTI ever. So Megan, that is something that's called COVID-associated cystitis. We now have publications describing this. It's called de novo. For people with no history of bladder issues, they're calling it de novo COVID-associated cystitis, which means it's a brand new symptom for you. The consensus is that it is an inflammatory reaction. With COVID, you get something called the cytokine storm, and it's the cytokine storm which causes all of the tissue damage. It's the cytokine storm which is killing so many patients. And so that cytokine storm not only happens in the lungs and different parts of the body, it can happen in the urine and in the kidneys and in the urinary tract. And so what the biopsies have shown, as well as some of the regrettably autopsies have shown, is that there's a really significant inflammatory reaction happening in the bladder itself. And then for patients who have died from COVID, with very, very severe COVID, they're actually finding live COVID in the bladder wall. Also, there was a paper that came out, I think, about a month ago, and it was about patients, men with COVID, who they've recovered from the COVID, and then they have, what do you call it? Erectile dysfunction. And which kind of makes sense because COVID isn't just a respiratory virus, it's a circulatory system. It attacks the circulatory system and the blood vessels. And erections are all about having good blood supply. And so if this limits blood supply, then certainly erectile dysfunction could be an issue, which would be a great marketing point for people, for men who are refusing to get vaccinated. If they realize that there's a shot that they get COVID, they'll never be able to have an erection again. Maybe that might be a little bit more of a motivating factor. But it's too soon. It's just too soon right now. We just don't know how long things are going to happen. We can't make that statement, but it would be a fairly compelling argument for a young man who might be resistant to getting the vaccine. If you let them know, hey, you might end up with erectile dysfunction, might be a motivating factor. Norman, dude. Norman says, a caution. I felt like I was coming down with COVID. All the symptoms, including the cough, turned out that I'd contracted a yeast infection. I've had them before, but I didn't put 2 and 2 together. I went to the urologist about the old prostate and urine specimen. Let's see, hold on. I went to the urologist and both the prostate and the urine specimen yielded yeast. I'm pretty sure I know how I got it. Eating too many Little Debbies and eating fresh grapes off the vine. Perfect brewer storm. Making alcohol in the gut. Yeah. We learned years ago that yeast goes along with IC many times in the digestive tract, more than it ought to. And if you have it, it exacerbates IC. Plenty of articles out there on yeast and how to suppress it. Thank you, Norman. Yes, and the National Institutes of Health MAP Research Network absolutely confirmed that. We do know that some patients who flared can be flaring because they have a candida infection. Not all, but some. If you flare when you eat sugar, if you flare when you eat carbs, candida and yeast would be logical to rule out. Judy says, does Valium suppositories help with tight muscles? Absolutely. It could. Worth a shot. Hi, John. Brandy says, I would think so since it's my relaxant. Yeah, right. Makita says, does anybody take boric acid? Boric acid, it might be used vaginally to help suppress candida. It's not a treatment for IC. Makita says, I noticed if I'm stressed, my pain increases. Absolutely. Absolutely. So that happens in the brain. That's part of your brain processing pain. So your pain. So there's a really good book. Let me grab it here real quick. Oops. This little book right here is a gem. When It Hurts Down There by Dr. Angie Storr. 15 prove-it techniques for alleviating pelvic pain. You can get this in our shop. This is, got super easy to read, really simple. And she talks specifically about the pain pathways. And so basically, where is all pain processed? The brain, right? So I don't know if you can see this or not. So let's say you're having bladder pain. So the nerves deliver the pain message to your spinal cord. And then from the spinal cord, it comes up and it goes through the lower midbrain, the upper midbrain, and then the upper brain. So it's a 3-step gating process. We call that a gate. The low brain, with the only purpose of the low brain is to send the most important pain messages through. So if you stepped on a nail, believe me, that pain message is going to go right up to your brain, and your upper brain's going to have you hopping and not walking on that nail. But if you 4 days later fall and break your arm, you're not going to feel the nail pain anymore. You're going to feel your arm, and that's the result of the spinal gate at the low brain. The midbrain then takes whatever pain messages that come through. The midbrain then processes them for context. So if you're riding a roller coaster and you get thrown against the side of the car and it hurts your side and it hurts, but you're laughing, your brain is going, but you're laughing. Your life is not at stake. So your brain will minimize that pain. But if your pain is accompanied by stress and anxiety or tears, your brain goes, uh-oh, something big is going on. Maybe your life is at stake. So what happens is contextually, the midbrain actually intensifies that pain. And that is indeed why you have more intense pain when you are under stress. And this book will tell you what you can do. You can stop or reduce that pain message in all 3 areas. It's just good information in this book, When It Hurts Down There by Dr. Angie Storr. And of course, we have a lot of this information summarized over on our website. Our website is free for everybody, icnetwork.org. Go on over there and read that too. Brandy says, do you know if Hunner's lesions are recurrent? I had them in the past with severe pain and urinating straight blood. The urine specimen looked like it was all blood, felt like glass in my bladder. They can. Yes, they can, Brandy. We're learning a bit more about Hunner's lesions. So we have research from Europe, which has identified some viruses in the urine of patients with Hunner's lesions. So We do think that for some patients, their Hunner's lesion is being caused by a viral infection. Or it could be neuroinflammation. We've got nerves that are very, 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 very irritated. But we had something very, very interesting happen earlier this summer where somebody published a paper, a couple of doctors published a case study of a woman with severe Hunner's lesions who also had a severe prolapse. So they went and they made the decision to repair the prolapse. And so what happened when they went in to repair the prolapse is they discovered that one of the ligaments that holds the uterus in place had severed. And so her uterus was backwards. It had rotated, right? And so when they repaired it and reattached it, they were stunned that her Hunner's lesions resolved completely. She's cured. She's cured. So that is the first connection we've ever had about Hunner's lesions potentially being the result of, it's called posterior fornix syndrome. And there's also anterior fornix syndrome. So you can go over to our website, icnetwork.org, and go into our blogs. And the title of the blog is patient with lesions miraculously cured, or something like that. Is it in this one? Here it is. It's also in our summer magazine, Hunner's lesion patient unexpectedly cured. Do I have any pictures in here? Let me just see. Hold on. What page is this on? Page 18. The year is just flying by my memory about some of the things we've worked on. I'm amazed I can retain what I retain sometimes. So here we go. Here's a term you didn't hear very often, posterior fornix syndrome. Sound odd, right? These pelvic pain patients struggle with many of the symptoms associated with IC, especially nocturia, urgency, frequently and abnormal emptying. But rather than having a bladder disease, their condition is caused by weakness or tears of ligaments, uterosacral ligaments that support the vagina. This often occurs after a difficult labor, leaving the uterus hypermobile and in some cases turned out of position. Therapy is usually surgery. So in this fascinating case study, 73-year-old woman, yada, yada, yada. And remarkably, after they repaired her ligaments, her Hunner's lesions and other symptoms were completely cured. The authors note that this was initially discussed 80 years ago. The concept of USL laxity causing chronic pelvic pain and bladder symptoms is not new. It was published in German literature by Henrik Martisu in 1938 and by Petros in 1993. This, however, is the first report that Hunner's lesions could be linked to this ligament dysfunction. The authors point to a very simple speculum test. You determine if the ligament is a problem, yada, yada. Then the authors raise an important point. Are patients being screened for this condition, which when identified correctly is curable? Fascinating, and yet again reminds us all that bladder symptoms aren't always the result of a bladder disease. A simple diagnostic swab could reduce the suffering of many. Further research is needed, yada, yada, yada. Anyway, okay, so that's in our magazine, and that's on our website in the blog, which is an exact copy of what's in the magazine. Brandy, I would definitely have them check to see if your lesions have recurred. Kathy says, just saw a urologist again for Botox in the bladder. He did a biopsy thinking he saw some cancer. It was not cancer. Praise God, hallelujah. Kathy, I'm so glad. He said, I can either live with chronic pain or get the bladder removed. I also have very sensitive skin, like me, and have had Hunner's ulcers. What would not bother most people kills me. Girl, I hear you. You know, when we've got this whole central sensitization, pain is different for us. You have neuropathy in my hands and feet. Can't stand anything touching my feet. Do you recommend anybody in Atlanta, Georgia? Dr. Angie Storr, no, not Angie Storr. Dr. Denise Pecht, P-E-C-H-T, Pecht is outside of Atlanta. Denise Pecht, P-E-C-H-T. They told you this 2 years ago, and then last year after taking Bladder Builder and Aloe for a year, my bladder looked normal. I stopped this due to lack of money, but we'll have to get back on this. I'm trying to get on disability now. I never sleep. Kathy, if you email me, I will send you a bottle of Bladder Builder, no charge, okay? We want to get you back on track. So Kathy, my email address, icnetwork@mac.com. I would be happy to give you a bottle of Bladder Builder if you think that will help. Makita, anyone have a good list of items to remove from the diet? Makita, right over on our website, icnetwork.org, we've got the master list of foods, which you can find, both the research-generated list as well as our own list. We also have a food app, an IC Diet app, but it's pretty old. It needs to be updated. Do I even have it on this phone? No, I don't even have it on this phone. Do I? I do not. I really need to take it out of the App Store for now. We just did our new app, BladderTracker, so I don't have money to update the food one yet. It's going to be another 6 months to a year or more. So this is our new app, BladderTracker. BladderTracker. And there is a section in here on food, but it's where you can just monitor your food. It doesn't tell you what the IC-friendly things are. Find that on our website. All right. BladderTracker is free. It's more than avoiding diarrhea. It will allow you to track your pain. It will allow you to track your stress. It will allow you to track exercise, food, etc. I can go over that a little bit if you want later. Megan says it's just after midnight. Thank you for staying up. Kathy says, I need the 101 book. I am my own advocate. Okay, now guys, listen. I'd love to give it to you all for free, but I can't. I can't do it all for free. But if you email me your address, icnetwork@mac.com, I will try to send a handful out, but it's just every book costs us just in printing alone like $17 just to print the sucker. COVID is really messing with prices. So, but I will come up with something and maybe, we'll work it out. So for anybody who needs IC 101, you really think you need it, email me, icnetwork@mac.com. I might be able to give a couple of them away for free. I've already given about 25 or 30 away for free. But it adds up, right? It adds up. Or what I will do is I will come up with a really good discount for you. Okay. Hello, Jill. Thank you, Donna. Gwen says, and the IC 101 is amazing. Gwen, if you could go over to Amazon and leave me a review, that would be great. Gwen says, I thought I would let you know my urologist canceled my cystoscopy due to not being able to get the supply, being the cover for the cystoscope, so they canceled it. Yeah, that's, unfortunately, that's it. COVID is real, my friends. Jill said, just asking, you're losing one kidney. Well, just asking, I'm losing my one kidney. Will this affect my IC? I don't think so, honey. I'm so sorry. I'm so incredibly sorry. I would not expect it to. Christy said, I got the microgen test, even though I've been having negative cultures from the lab. The test showed that I had bacteria in my vagina and urine that was not showing. Also had a stool test that showed bacteria in my bowels. I'm on 2 antibiotics right now with probiotics. I can't stay on here right now because I have company, but wanted to let you know that they found quite a few different bacteria. And she says the test is worth guessing. And so, guys, just really remember that there are lots of bacteria in your bladder. They're supposed to be there. But there are also pathogenic bacteria that probably shouldn't be there. Same is true with your bowel. There are billions of bacteria, beneficial bacteria in your gut. So bacteria are not the enemy here. What we have to do is we've got to create a good balance of bacteria. In the future, I think we're going to be treating a lot of new UTIs with bacterial therapy with the right bacteria that will kill the bad bacteria. I think that's going to be in the future. We also now have UTI vaccines coming up. Karen says pudendal nerve injection with allograft with stem cells can really help if it's nerve pain. I have it about once a year. Hey, Karen, I would love to do. Karen, if you're still there, if you're still there, could you email me icnetwork@mac.com? I would love to do an article on that. I would love to do an article on that. Jennifer says, could you talk most about postmenopausal IC? Oh my God, what can we say about getting older? It's so weird because you feel so young. You feel, I mean, like I feel 25. It is impossible for me to be 61 years old, and I am 61 years old. It's crazy because emotionally I'm a kid. I asked my dad, he'll be 99 in 6 weeks or a month or 6 weeks. Well, on Veterans Day. I said, Dad, how old are you inside? He goes, 24. It's very surreal to be getting older. So really the only thing that we're really going to see in the bladder is more dryness and more sensitivity, things like that. All right, Donna wants to do a Zoom. So why don't we, and I need to pee. Oh, Jennifer, thank you for the stars. Oh, 4 weeks in a row. Thank you so much, Jennifer. I really, really appreciate that. Megan says, would Claritin and antihistamine help? Possibly. We're trying. My email address, icnetwork@mac.com. icnetwork@mac.com. M as in Mary, A as in Apple, C as in Charlie. Oh, God. Crap. I forgot to reset the Zoom. Hold on. Remember, I had a problem last week with it? Hold on, my friends. Oh, I meant to do this yesterday. And I did not do this. Zelda says, I'm 75 and had a gynecologist tell me I was too old to get IC. Yeah, but you're just at the right age for genitourinary syndrome of menopause. Hello, also known as IC in older folks. All right, hold on. Okay. Crap. How am I going to do this? Shoot. Hold on. You know, somehow my master account got disconnected from my Zoom channel. Hold on. Let me just try this. Okay, let me just. All right, hold on. I am telling you, my friends, life is busy these days and stressful. If I had to rate my stress today, I would say on a scale of 1 to 10, it's about a 7. Hold on. Okay. So in the Zoom meeting, this is your opportunity to come in and get some coaching. So, we leave the meeting on, open. It's on Facebook and YouTube. They'll hear your voice. They won't see you. The only people that will see you will be other people in Zoom if anybody else wants to come in. If y'all wanna do it, that's fine. If you don't wanna do it, that's okay too. I got no sweat in this game. What is this doing? Okay, hold on. Two. Let's see if it will. Oh, okay. Yes! Success, I think. Oh, okay. Megan says, "Wow, you look 40." You know, I'm telling you, menopause and hysterectomy ages you like that. I swear, most people thought I was in my 30s, um, before I had my hysterectomy 4 years ago, and then bam, it added 10 years on right away. Okay, I have got the, Zoom meeting opened, so let me do invites. Alrighty, so here on YouTube, there's your invite. And Mara and Zelda and Sierra, just hold on one sec real quick. Now I got to get it over on this other computer because we're on two separate computers here. Alrighty then, let's see here. And it doesn't help that all my nerves down where I'm sitting are worked up right now. Got some sensitivity going on here. All right. All right. I'm putting the Zoom link in here right now. Ooh. Oh, wrong keyboard. There you go. There's your Zoom link. All right, guys, I need to take a quick bio. This is a perfect opportunity to please go use the restroom. I'll meet you right back here in a minute or two because, you know, there's one thing about IC patients is that we tend to be pretty quick in the bathroom, unless, of course, we have tight muscles. All right, so quick bio break. Be right back. All right, I'm back. Okay, and like, okay. So the left side of my pelvic floor is a little spasming right now. So normally what we would do I have it here? Oh, yeah, look. I can't turn my, so this is a lacrosse ball. And so, I don't know if I can demonstrate. So what you would do is you put the ball potentially right here, but then you'd rub up against a doorway or a wall, or you'd be on the ground. I did a new workout program about 3 weeks ago that just massacred my levators. You know, where's my thingy? And I have had, and everything is so freaking sensitive because of it. So it's this new workout program. And I can tell you exactly where it got me. So here's your pelvis, right? So here's your pelvis. And we're going to put on the lowest level of muscles, which are your levator muscles. So on the back side, the new workout program that I did actually hit these muscles right here. And so here's the sit bone, right? And so a lot of us have sensitivity right around the bone, like right here, like holy hell. I've always had a lot of sensitivity right there. But right now, my sensitivity is, here's my tailbone, is right here. It's like right on the inside of these bones. And these muscles got really contracted. Then it pissed off my rectum, and my rectum started to hurt. And so I have been trying to get in here with I have a little tennis ball to try to release them. And it's about halfway better, but like, oh my, it's stunning. Actually, I'm holding that upside down. I was holding that upside down. It's right here. Like, I wish it would behave. Every day is a new opportunity to learn things about your body, right? All right, so let me check Zoom here. Hold on. Where did it go? Okay, that's not Zoom. There's Zoom. All right. Hi, Donna. Hello, Lisa. Hi, Sierra. All right, so anybody who wants to come in, feel free. Here on Facebook and YouTube, you guys will be able to hear what they're saying, but you're not going to be able to see them. It is not recorded. You don't have to worry about it. Nobody will ever listen. What am I going to do with them? I'm very close to deleting a lot of, we're at like support group meeting number 158 now on YouTube. More on Facebook, and I'm getting ready to start deleting some of those old ones. So, all right, Donna asked first, so I'm going to see Donna because Donna is the woman who keeps me together when I'm falling apart. Are you there, Donna?
Hang on, baby.
Hey, girl, how are you today?
Hang on, baby. I'm trying to get me there.
Okay.
Let me get there. I was there, but not there. So let me get there, baby.
Okay.
I'm gonna get there. I love you. Yep. Get all prettied up. Hey, am I there?
I can hear you. I just can't see you.
Okay, wait a minute. Let me get there. Let me try.
Well,
how do I? Oh
here.
Gosh, I used to be really good at this.
No,
right?
I think I just sent you a link asking you to start your video.
Start my video. Okay, I'm gonna start my video. It says start my video. Oh, here I am. Hey, let me tell you something.
Yeah.
Come on. I need to get there. Come on.
You're here. You're here.
I can see you, but I'm in like a small screen, right?
Oh. Okay.
Yeah.
Well, you're good.
I want to be in a bigger screen. But anyway, you know what? Here's the deal. I look like this on purpose. I want you to know I didn't care who was on today. I wanted to look like this on purpose because I wanted everyone to know. I know people can hear me. And my IC family, I want you to hear me. And for Jill, just for 1 second, just hang tight.
Okay.
And then you can correct me. I wanted, if you are right now on Zoom, I want you to see what I look like. I wanted you to understand that not every day is always a good day. Not every day is always a good day. Sometimes days are just what they are.
Yeah.
And that's okay. And that's okay. I remember when I first got, and I'm not going to try to get this long. I just want Jill to just hang back because it's IC Awareness Month and it's not about her. It's not about Jill. It's about us as our IC family. And all I want to say to you is, I remember when I first was diagnosed with IC, and I was on my side in the bed with one finger going through, trying to figure out what the hell was going on. And yes, I haven't, and I'm not saying this for some accolades, but I do have a master's degree in healthcare administration. And so I was with research. I understood that you have to do your own research. You have to get out there and do it. And so I did. And I was one fingering, trying to figure it out. In so much pain, guys, so much pain. And I told Jill, I made notebooks up for the doctors, for my urologist, for
anybody.
For my urologist. I'm trying to figure out who didn't I make a notebook for. And then they finally told me, stop making them. It's too much money. You're just giving up. But they were the ones that didn't know. And I looked at Jill's videos and I started thinking, and what she was trying to get across was the empowerment that unfortunately IC patients have to do. We have to do it. It's not like we have cancer. Cancer research is out there. It's not like we have, bone issues or osteoporosis. It's already there. With IC, it's different. It's different, and we have to empower ourselves. So for all the newbies that are out there, for all the ones that are seasoned, I'm saying to you, continue to do what you're doing. The newbies that are out there, my gosh, I know it's tough. I've been listening to you right now about the ones that are on pain medication. I've been there. You know what? Lay on your side and do the one finger. That IC Network website, guys, I'm telling you, it's an abundance of research for you.
Thank you.
It's got so much information for you. And let me also tell you, for all of you that are listening, please, 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 for all you IC brothers and sisters, for this month and for the next September and the next September, that 101 book, if I had that 101 book, Jilly, I love you. If I had that 101 book and all my IC families, oh my God, I wouldn't have to do the stuff that I was doing. I would just take that book in and go, see, guys, look.
Here it is.
Here it is. So I know, baby. I know. You know what? I know you probably had this under your belt a long time ago, but you finally came out with it, and God bless you. You know what, guys? Let me say this to you. I know it's tough for you, Jilly. You're gonna come in later. I know you are. You're gonna come in and you're gonna correct me. You're gonna do what you need to do. But I just want to, because it's IC Awareness Month, September. We're almost done. Let me say to you, with COVID, I went to see my mom. My dad died last year, and I wasn't able to see him during COVID. I wasn't able to do it, and it hurt me. But I was okay. I knew I had that relationship. But this year, I was up and down in Ohio. Up and down. I did it. An hour and 40 minutes. Gosh darn it, I did it, guys. I did it. You can do it too. Just try. Just try. I told you, if I can do it up and down once, then you know what? For an hour and a half, I can do it for 2 hours. I can trust myself, trust my body. And hey, it wasn't that I didn't have challenges while I was in Ohio. I did honestly. But I also had family members that said, are you okay? What do you need? Are you going to be all right? Lay down. Do what you need to do. I had some support. And guys, listen to me. Even if I hadn't had the support, I know I'm the type of person who I would have done it anyway, Jilly. I would have
Yeah.
laid down. I would have told them, forget you. I don't care. I have to take care of me, because if I don't take care of me, who else is going to take care of me? I
Yeah.
have to do it. And
Yeah.
so I did it. All I'm saying to you, IC family, is I've listened to you. I have. I've listened to Jill all these years. I have done it. She is here for us. She's not always going to be here, guys. She's not going to always be here. We've got to band together and do it ourselves. I look like crap. I don't care. Fine, then do. I don't
Well,
care what I look like.
I think you are a very beautiful woman, and you look
Well,
more
see, you're
beautiful
being nice.
today.
See, it's not your turn yet. See, I know it's tough. See, it's not your turn yet. See, because it's not about you, Jilly. It's about us. And I know you're laughing because I know it's about us. And I love you. I love you. It's about us and IC Awareness Month. It's about us banding together and empowering ourselves. You're on the sidelines, baby. I'm sorry to tell you that. You're on the side. I love
Good.
you. Hey, you're on the sidelines, girlfriend. You're just standing back and you're going, what are they going to do now? And that's what I want you to do. I want us as IC family to band together, not just in September, but every month, every day that we can. And guys, I know it's hard. I know it's hard because I know it's hard. I have my bad days. I have my good days. I have my days when my bowels are messing up. When Jill was just talking today about her bowels, I was like, okay, everything's going fine. But yeah, when it's time for me to have a bowel movement, oh my God, I think my whole entire world is going to fall apart because my nerves are so bad. I get it. And I'm taking Peoria. I'm doing what I need to do. And hey, and I can eat mostly anything that I can, but boy, when it's time for me to have a BM, and those BMs are so nice. They're not hard, but man, that crosstalk starts working, and it doesn't matter. I still struggle. To this day, I still struggle. So when there's days that are good, you go, oh, I celebrate it. And then when there's days that aren't, you go, boy, I wish that I could just have those good days back. But I'm here to tell you, and I have it written down, and I'm going to go through it quickly. The IC website is so important. Please, 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 for all of you newbies that are out there, please, please, please go to the IC website. Take some time. Just take a day. Take a half a day if you can. Go through the website. There's so much information that's there for you. I've done it. I know it's there. I already know it's there because I've gone through it. But for IC Awareness Month, if you haven't done it, do it. It will empower you to no end. Someone just talked about Claritin. And that's for your mast cells. I have serious allergies, and I want you to also know I've been doing Claritin D, but I also want you to know it does raise your blood pressure. That Claritin D will do that. It will raise your blood pressure. Jill, keep that on the back burner for you to address that later on. It will raise your blood pressure, and I am on blood pressure medication. I'm just saying, but it definitely takes care of my allergies. So if you are dealing with those mast cells that are part of us when we do have IC, Claritin D I've found that it's some of the best that I've ever had. And I've done Zyrtec. I've done it all. I have. Okay. The reviews. Please go on to Amazon and do reviews. Please do reviews wherever you can. For that 101 book, if I had that book a long time ago, 5-6 years ago, my God, I wouldn't have to do the stuff that I've done before. Trust me when I tell you, IC family, I know you're out there. I know you're listening to me. I know you are. I know you're listening. I would not have had to do the things that I did. That book is phenomenal.
Thank you.
Go onto Amazon and do a review. It is, and I know Jill said to you, she said to you, that woman is so generous. I'll try to find a way to give you a book. I will try to find a way to see that you get one. IC family, that 101 book will change your life, especially for the newbies. And you know what? For the ones that aren't newbies, you got some stuff in there that will change your life as well. And let me say to you, Also, how we are with our longevity with IC Network. I know it's tough. I know it is. Our Jilly will not be with us forever. She won't be with us forever, guys. She won't be. We have to learn and continue to learn and keep it up here in our heads. We have to. Let me tell you something. And this is honest to God true. When Jill would come on, when I understood that she was on YouTube and that's where I am, I would sit down and I'd take so many notes. And I would just take notes and notes and notes and notes. And then I would take those notes to my doctors because I would be like taking notes all the time. It was like being in school. I want you to do that. I want you to do that because she's not going to be here forever, guys. She's not.
I'm not planning on leaving anytime soon, guys.
I know, baby. Keep it. You're supposed to be quiet. I know. I'm challenging you. It's gonna come because I know later on you're gonna address everything that I'm saying. But I want the IC family to understand you're not gonna be here forever. And I love you. I love you. I love you.
Thank you, honey.
You're not gonna be here forever. And we need to do our homework. We need to do it, and then we need to come to Jill and then say, I did my homework, Jill. I did. I went to the IC Network. I did as much as I could. Now fill in the blanks for me.
Yep.
And that's why she's here. She is one of the most giving and forgiving people that I've ever met in my entire life. And she doesn't pay me to say it. It's because I know. I freaking know. Okay.
Okay.
A couple more things.
Okay, 1 more minute, hon, because we got people waiting. So you got 1 minute.
I love it. And Lisa's waiting. And Lisa, I love you, baby. Yes, I know, Lisa. I know. And then also, one more thing that I want to say. Jill holds back. She doesn't think she does, but I know her, and she holds back. That woman can come out and tell you things that will blow you away. And I love that about her because she does it when she has to do it. And we in the IC Network, we should know it and trust in her that she will do what she needs to do with the information that she gets. And trust me when I tell you, IC family, I'm not just throwing it at her just because. Oh, no. No, no one on this earth deserves that. You don't just throw things and put people on pedestals. You don't do that. You know what you do? You give people their kudos when they are, and she doesn't sit back on her laurels. And let me tell you something. When we as IC Network, when we as the IC community need to know it, you better bet that doggone it, she's going to let us know. But then there's a time when she holds back. I know it. She may not admit it, and that's okay too. But somehow down in my bones, I know you, Jilly. You got it going on, girlfriend. And you know what? I'm going to end with that because
thank you.
I love you.
Okay, big hugs.
And Lisa, I love you too, baby. And this is all because of IC Network Month. What's today? The 26th or the 27th?
26th.
We don't have that long. COVID has taken a lot of us for granted. And if I felt like I would come on the way that I am and say, this is my contribution to IC Network Awareness Month.
Thank you, honey. Thank you very, very much.
And you know what? I love you. And Lisa, I'm going to stay on and I'm going to listen because that's my girl too. But Jilly, I know you'll correct me. I know you will.
No.
I just wanted to throw some things out there for you because I feel like no one says it. Maybe they think it, Jill, but no one says it. And I'm here to say it. Hit me in the head all you want, but I'm here to say it.
Thank you, Donna.
You know what I'm saying?
I do. Thank you. You guys, understand that when you are a leader in the community, and right now I'm the spokesperson for the leader, I'm the spokesperson for the IC community, basically. Amen. In the United States and close to being in the world right now. And I see the good side and the bad side. I see people who are part of the movement. They want to be involved. They contribute. They understand that I don't know everything. The people I love the most are people who will help me be better. I want to be better. But I also take more than I think my fair share of lumps, and there are moments that those can be quite painful too. And so I need to have people that I talk to, like Donna and Lisa and others, that help me through those moments when it's challenging for me. And we're working with patients. Imagine, and I'm not even working in a clinic with patients. I'm just working with patients on the phone. But every single day, all day, working with patients who are it's hard. And we see the good side and we see the bad side. And then we've got consumer awareness issues like the Elmeron issue. I'm the person who broke the Elmeron eye story. I didn't sit on that because I believe that you had the right to know about it. Whereas the other IC group, I do not believe has yet, if they have made a statement, it was quite late, where we told you within a week that we had new research that showed that Elmeron could cause retinal disease. So there's always a lot of decision making. There's always a lot of stuff on the backside, and just understand that I'm not perfect. I'm going to make mistakes. I double dog dare anybody to come online and answer questions for 4 or 5 hours at a time. You're not necessarily going to get everything right, but the intent is always there, and the intent is to help. So thank you. All right, let's go. I needed that. You guys, I did have a very hard week, so I needed a good pep talk. So thank you, Donna. Right back at you. God, there's so many people. I wish you were here. I wish we could all just hang out and
I love you so much.
Play games and just.
I know. And I'm in tears right now, and I just don't know what to say.
Well,
I don't know what to say. It's too hard. Sometimes.
We are all sisters and brothers in spirit. So, all right, I'm going to come over to Lisa now. Lisa, are you there?
Yes.
Hey, girl, how are you today? How is life in Texas?
I'm good. I don't know how to get my tennis ball off of there.
Let me. There you go. I just sent you a link.
Oh, okay.
There you go.
I'm walking down the stairs. Okay. I'm good. I heard every word Donna said and couldn't agree with her more. And as she was talking, I thought to myself, I wish there were a Jill Osborne in the world of microscopic colitis, which is my other condition. And it's the one really that's giving me more problems now. And so, I'm on a couple of Facebook pages, but so often I think if the microscopic colitis world had a Jill, we'd all be better off for it, because we suffer in a different way, but the same way.
Yeah.
So, my IC's been doing great. I credit that in large part to Jill. It's really just, if I had listened to the lights behind me, if I had listened to the doctors and did everything they told me to do, and I'm not telling people on here, don't listen to your doctors, but I am saying, listen to them and then educate yourself and think about what they're telling you. Because if I had done I looked for the right doctor. I went through several doctors, and the first few were men, and they were horrible. And the first guy told me that my issue wasn't, because my initial IC always got stirred up by sex. And he kept saying, it's your own fault. It's your own bacteria. It's not the guy's fault. I don't know why you're blaming it on the guy. He was just so humiliating. And, I finally found a urologist who actually, she's retired now, which is a bummer. I don't have a urologist now. But if I had done everything they told me, I'd be a mess right now. And instead, I educated myself. I found the IC network. I did some consults with you, Jill.
Mm-hmm.
And I ended up doing PT. And, I went into complete remission for like 15 years.
Nice.
And then it came back for a while. And I did it again. I did the same things I did before, and I did PT again. And it took me a while. My other PT lady was retired, and I had to find a new one. But not all PT people are the same. Not all urologists are the same. And you just have to know what to ask. And the way you know what to ask is by educating yourself and reading a lot of the stuff that you have on your website. So that's my 2 cents.
Well,
but I'm doing good. I had a birthday 2 days ago. Woo! And I turned 71, and I went out to dinner with outside. I never eat inside restaurants, but I went out to dinner with 2 younger friends. One was 59, and she just recently had a facelift, and she looks wonderful. And the other one's 46, and I was in between them, and they took a bunch of the server took a bunch of pictures, and when I got home, I looked at them and I thought, oh shit, I'm not posting these on Facebook. I mean, I had makeup on that night and everything, but still, I looked 71 and they looked 20 years younger than me. So I thought, nope, there's no question who is the older person in this picture. But
hey, Lisa, I love you. I love you.
I love you too,
Donna. Baby. I love you. We've been through it, haven't we? You look
for
beautiful, baby girl.
You do. But you know,
I don't know why you kept saying, Donna, that talking about how you look, because you look great.
I agree.
So, hey, I got the bags under my eyes and the whole 9 yards, but you know what? I don't care. You guys accept me no matter what. You know what?
Absolutely.
That's right. That's the key point, guys. Is that we all accept each other. You know, this is the tie that binds us all is the fact that we have all gone through that same journey of being in pain, being scared, having people who were not supportive, having doctors who didn't know what to do. We were up all night crying, begging for relief. And there's just nothing worse than being up in the middle of the night, unable to sleep, in pain over and over. And it changes you. You're not the same person after you've been through this. Your priorities change.
Yeah.
The thing
now that I've been through physical therapy, I don't know if you can see me behind me.
Yes,
let me see. See my harp?
Yes.
I can sit and play the harp for hours at a time, and I couldn't do that before.
Isn't that wonderful?
Sit like that.
I mean, because you are night and day better. You are so much better now, Lisa, than you were when we first met.
That's right. Kidding. That's right.
Yeah, that's so glad. That's so glad.
You know what I used to do, and this will be it for me. I'll just say this.
No.
I used to go to bed at night, and I used to not be able to sleep, and I used to have to get up so often during the night to pee, and I was always in pain.
Me too, baby.
I would replay Jill's these taped video calls.
Yes.
So that all night long, I just had Jill's meetings running, and it helped me feel better.
Good.
Yeah.
You know what? And I'll tell you something else, Lisa. For people who don't want to get on who don't want to get on the Zoom, please, if you are out there and Jill says, hey, I do Zoom, let me tell you something. Get on Zoom, because you know what? You're not paying for anything. You whatever minutes, 5 minutes, 10 minutes, whatever Jill gives you, that is more than anyone can ask. Because let me tell you something, when she charges, because she has to make a living too. Come on, people. She has to make a living too. She's a human being. And you know what? She gives up her time and her heart. But when she says, hey, I'm opening Zoom, all of you jump on Zoom, because you get her time for free. And it is the best time you could.
Well, and you get my time for free.
Lisa and I know this. We're oldies and goodies. We know that when you get on with Lisa, when you get on with Jill on Zoom, and she sits there and she talks to you, and she may go over, and we'll be talking, and she'll go, okay, I gotta go. Let me tell you something. That's the best 10 minutes, 15 minutes that you could ever have. So do not get on Zoom. I don't care how you look, how you are, we don't care. Get on Zoom, because it's the best thing that could have ever happened to you, because you get her personally.
And Jennifer said, Jennifer,
in your life for free.
Jennifer says, unfortunately, the Zoom isn't working for her. But guys, I answer the phone too. You can call the IC network and you talk to me, and it's free too. So, all right, we need to go to Sierra. Sierra, are you there, honey? Hey, girl, how are you today? How is life?
I'm fine. I was listening to Donna's story.
Isn't she great? Yeah, she's great.
She gives a powerful message.
Okay, and so how are you feeling today? How is your IC?
I'm doing fine. I'm still in pelvic floor therapy.
Okay. Okay.
Yes, and it seems to be helping.
Yeah.
But I have to have another bladder extension on the 13th of October.
Okay. Okay.
Yes. This time it lasted for about 5 months.
Okay.
Because I'm taking, at first it used to last for like 2 or 3 months, but since I'm taking the pelvic floor therapy, it seems to be seeing a big improvement.
Love it, girl. I love it. I love it. I love it. Congratulations. Here's another patient who, when you finally got into the muscle work, things started to improve. So guys,
I learned it from you, Jill, and thank you.
You are very, very welcome. All right. Well, listen, you're doing good today. So let us go.
And you said the IC book, you can email it to my address.
If you email me icnetwork@mac.com, I will see what I can do. I will see what I can do. Okay. I might email it to some people. I might not do a hard link, but a hard copy, but I might be able to do a PDF.
Jill, listen to this one. I will send you $30 as a check, and you know what you can do with that? You can take that and give it towards the IC Network 101 books.
Okay. Well, $30.
And don't get me wrong, guys. I'm not doing this because I've got just so much money. I'm doing it because I know that Jill does it on a regular basis. And you know what? For people who are, especially in the COVID era, are African American, are people of color, are people who are Caucasian who just can't afford it, I'm going to send you a check, Jill, for $30. And I want you to put that towards anyone who wants a 101 book.
I'll be able to send out 2 101 books with that donation. So that's great.
That's all I have to say about that, Jill.
Thank you very much, hon. All right. Well, then let us go to now Jeannie and Mara. I don't remember which one of you came in first. I'm sorry. So if I get it wrong, don't take it personally. I think who came in first? I think Mara came in first. So let's go to Mara. Mara, are you there?
I am. Hi, Jill.
How are you doing?
Ladies.
Hi, baby.
I'm doing okay. I'm very new to this.
Okay.
I was just diagnosed by an urgent care doctor.
Mm-hmm.
So I started out about 5 weeks ago with what I thought was a UTI.
Okay.
And I did an e-visit with the doctor. They did not do a culture at that time.
Okay.
And they directly put me on an antibiotic. I knew that this was different. I've had UTIs in the past, and I knew that this was different because I had and this is kind of embarrassing, but when I was urinating, it smelled literally like cat urine.
Okay.
And I had never experienced that, and the urine was cloudy. That went away.
Okay.
And I did the 7 days of antibiotics. I was still having symptoms. I wasn't having an issue urinating. I would urinate fine, but the whole time I was experiencing burning in the urethra. And in the bladder, it was just a lot of discomfort and pain, and I was just feeling miserable.
Okay.
So I did finally go, and I had a urine culture. Nothing didn't show any signs of a UTI. And I went and saw an urgent care doctor, no signs of a UTI.
Okay.
And so she did a pelvic and took a sample, nothing everything looked normal. They did find some sugar in my urine, so they did a diabetic, like a blood test.
Yeah.
No, blood sugar's fine.
Okay.
So they put me on this medication.
Well, honey, let me just stop you here for a moment.
I guess it's to help like with the bladder for spasming and
Okay,
stuff like that.
Mara.
I don't quite understand exactly.
Mara, can you hear me?
But I do go and see a urologist this coming up week.
She can hear me. Okay. Are you there?
Yes.
Okay. So let me just. I had to turn your camera off because you froze.
I can.
It froze and I couldn't.
I can hear you.
Okay.
Can you hear me?
I can hear you just fine.
I am.
So let me just ask you some questions, okay? So question number 1 is, how old are you? How old are you, Mara?
Okay. Sure. I'm 52.
Okay, yeah. See, the connection's getting really bad. It sounded like you said
52.
52.
Can you hear me?
Yes.
52.
Okay, so and you've only had symptoms for 6 weeks?
Yes.
Okay, so you are actually excluded from a diagnosis of IC right now because it depends upon which definition you're looking at. Usually it's 3 months to 6 months of symptoms before somebody would be diagnosed with IC. Okay, so the fact that you're 6 weeks out, it might be a wee bit early to diagnose you with IC, but you said that you had urethral pain. And so the missing piece of this puzzle that is possibly, if not probably, involved in your symptoms is estrogen atrophy. It's your age, right? Think about your bladder for a moment. The bladder is the only organ in the human body. Here, I got to mute a couple of people here real quick. Hold on a sec. The bladder is and the urethra, the only organs in the human body designed to hold toxic waste because it's body waste. It contains ammonia and urea. So how does the bladder and the urethra protect itself from whatever in your urine? The answer is that your bladder is covered with a really thick, robust coating of mucus. We call it the mighty mucus or gag layer. And the purpose of that mucus is to act as a barrier. It prevents urine from reaching the fragile cells. Unfortunately, that mucus is estrogen dependent. So when you're young and you have lots of estrogen, you have lots of mucus and you can get away with stuff. But unfortunately, you and I are not young anymore. And it's the urethra that is the canary in the coal mine when it comes to estrogen atrophy. And it's the urethra that often starts to hurt first. And it will feel like there's a drop of urine stuck in your urethra that won't come out. Okay. Mm-hmm. And if your urine feels hot, almost like it's burning you as it's coming out, we call that urine burn. And it's not burning you. That's just speaking to the quality and health of your skin. That's called the genitourinary syndrome of menopause, also known as estrogen atrophy. And so that's not a disease. There's no disease happening here. It's just that your skin is changing as you've gotten older and your bladder can't defend itself like it used to be able to defend itself. And so if your vulva is dry and your vagina is dry, then so is your urethra and so is your bladder. And so if I were to bet $100, I would bet $100 that your symptoms are probably are beginning simply because of aging. And I say that because it happened to me when I was 51.
Okay.
Okay.
Do you would you recommend going to a urogynecologist then,
Or-
and having them
or your
do the
or your gynecologist, or just your gynecologist? What I would do is I would search on the internet. Although I have it over on our website too, and I have a video on our website called the Estrogen Chat. You can go to the Estrogen Chat. Um, uh, uh, you need somebody to look at your vulva and vagina, and let's see if you're starting to show changes in your skin. The odds are you are. They can see it. We can't see it with the naked eye, but they can see it. And if that's the case, what they're going to do is they're going to give you a topical estrogen to use, usually vaginally and a little tiny bit at the entrance to your urethra. And until that skin has the ability to heal itself and improve a bit, I mean, because your skin will immediately start using that estrogen to produce mucus, you are going to have to be careful with your diet. You should not be doing coffees or teas or sodas. Uh-oh. Uh-oh. All right. Which one do you do? Do you do the coffee or do you do the soda?
I'm a coffee.
Okay.
Addict.
Okay. So
Yeah.
how many cups of coffee do you have a day?
Yep.
How many?
Fess
up.
I'm probably about 4.
Woo!
5.
Ooh, buddy. Yeah. So you
like Starbucks.
I mean, I love Starbucks. I love Starbucks too, but it finally got to the point where, yeah, the skin, it wasn't taking it anymore. So, you know, what you could do that in your 30s and 40s. In your 50s, you're not going to be able to do that unless we do stuff that's really going to help your skin first. So I have a couple of suggestions for you. So I get it. I totally understand. I love coffee too. I can't do it anymore because it messes up my heart and I end up in the hospital. But
Mara,
Yes, ma'am.
girlfriend, stop that coffee.
It's so bad for me on so many levels, and I know
I
this.
do it too. Hey, once or twice I do it too, baby. I love you. I do it too. I know, and that's the good stuff. That's when you sit here on YouTube, on Zoom, and you tell her that, and she gets right on your butt. You know what I'm saying?
Hey man, been there. All right, so understand right now, and let me grab this tube here. Hold on a sec.
And Jill, let me tell you that I am starting menopause right now. I've been this year, like I was 2 months, I had no cycle, and then I just recently got it again. So it's doing this whole roller coaster thing.
Hey, have you had the rages?
I'm getting the night sweats.
Yeah.
I'm like, I don't want this.
I know. Have you had the rages yet where you're just suddenly furious and you want to hit somebody, but you don't because you're not going, and it like only lasts for like 10 minutes, but it's scary as hell to be that angry.
You know what? It's been a difficult year for me. And so it's hard for me to know what is biological and what is, mental.
I get it.
I lost my mom. I'm going through divorce. I've got kids that are coming and going.
Yeah.
And so it's really, really been really hard for me to know exactly what is physiological and what is mental. And, I'm on, I take antidepressants to try and see if I can look at but I've been on those for years. So that's nothing new, but so yeah, I don't really know what's going on. I have had the night sweats, and I'm on gabapentin for night sweats, which seems to help. I'm not gonna lie.
You need this book.
Manifesto. Okay.
You need this book. It is fabulous. Okay. Don't assume that you have control over some of the things that are happening. You are going through reverse puberty, my friend. Remember all the teenagers when they're going through puberty, how emo they are and how easy to trigger? Well, girl, that's where you are. You're going through reverse puberty, and it's it's sad that it's, you know, we as a society, we throw away people, you know, who are older. I was just, in fact, God, you guys, you got to hear this. I think it's in China. If you are 30 years old and unmarried, you are considered a forgotten woman. And if you are 30 years old and not married, you are considered unemployable.
Yes.
Society inherently it values those who are younger and minimizes those of us who are older. And it's shocking because, like, I'm so much more knowledgeable than I was when I was 32. Now at 61, you know, almost 30 years later. And yet, thank God I have my own business, because it would be very hard for me to find a job. So we have to be, we cannot allow society to minimize us just because we're older, because I'm sorry, we're awesome. And we're capable of doing many good things, and we're going to continue to do that. But now we gotta get real about your coffee, my dear. We have to get real about your coffee.
Yes, Jill.
So,
yes, ma'am.
All right.
Yes,
So,
all right.
okay. So here is a 3-dimensional picture of your bladder wall. Okay. So we have, at the lowest level, we've got blood vessels and nerves. Then we have 4 layers of the biggest cells in the human body. These are urothelial cells. And then above that, in blue, and of course it's not really blue, we have a layer of mucus. And the purpose of the mucus is to keep anything up in your urine from reaching the nerves and the blood vessels and damaging stuff, right? But look at what happens as we get older. Our mucus gets thinner and thinner, and in some areas it might actually go away. And so now anything that's in your urine, bam, it's going to reach this area right here. And then there's a whole biological process that happens there, and eventually nerves get involved and you get frequency urgency. So if you continue to do that level of coffee where you are right now, you're only going to be in a world of pain. So this is what we have something called the IC Network Coffee Challenge. Okay, and the way the coffee challenge works is, if you're in a flare, you should not be doing coffee at all. Okay. The first thing we're going to do is we're going to do chamomile herbal tea and peppermint herbal tea. See how you do, because chamomile and peppermint are nice, smooth muscle relaxants, and they have the ability to calm stuff down. If you do okay with the chamomile, your next step is going to be a rooibos coffee. And a rooibos coffee, this is rooibos tea. This is an example of a rooibos tea. This is called Harney & Sons Pumpkin Spice Rooibos Tea. If you like Starbucks pumpkin spice, girl, I've drunk this for years in the fall. It's wonderful. It's pretty close. Not irritating at all to the bladder. This is from Harney & Sons. They've been out all summer. I don't think we have any. We haven't had any for months. Barnes & Noble buys this in bulk. You can usually go to Barnes & Noble and get their seasonal coffees. There's no caffeine in it. Really, really good. Okay. If you do okay with this, your next step is going to be an herbal coffee. And let me see. Let me go get it. Hold on. Let me go get it. Oh, my legs are sore.
Bar girl, you got to stop that coffee. I know it. I do the coffee too.
Well, you know, it's interesting. I don't drink coffee. Everybody's like, oh, the caffeine. You want the caffeine. That's not why I drink the coffee. I drink the coffee because I like the cream and sugar.
Yes. Yes.
So that's where I mean,
but
and I love the smell of coffee, but if I had to drink coffee black, I wouldn't drink it.
Oh, ditto. All right. So you've done, right. Okay. So you've done okay with the chamomile peppermint. You've done okay with the rooibos. Now your next step is going to be an herbal coffee. This is Dandy Blend. This is what I drink. I make frappuccinos with this. I make lattes with this. This is freaking awesome. This has got to be the best herbal coffee on the market. It's not bitter because it has a little bit of dandelion in it, which is sweetened. It's very smooth. It makes great frappuccinos. It's like literally a teaspoon. You put a teaspoon in a cup of water, dissolve it, throw in your ice, put in a blender, and you're ready to go. I mean, so this would be the next step. If you do okay then with an herbal coffee, then you go to a real coffee, but a low acid coffee. It's a low acid because of the roasting method. Air roasting produces less acid than metal bin roasting. And the brand, there are 3 brands. Bella Rosa has the lowest levels of chlorogenic acid in the coffee industry. And they make a regular, they make a half calf, and they make a decaf. So what I would suggest that you think about doing is getting the Bella Rosa half calf and doing that for a couple of weeks, and then going down to the decaf, because we really do need to try to eliminate the caffeine, because the caffeine is just going to make you pee more. So Bella Rosa is one option, and their half calf is a great transition. This is their full calf. This is a Morningstar, but we've got half calf and decaf. Or you can do Tyler's. Tyler's, he calls it a no acid coffee. There is a little bit of acid in there on pH tests. It's not perfectly neutral. Or you can do Simpatico low acid coffees. But the one that has the lowest level of chlorogenic acid is Bella Rosa. And so that's the one. And it makes it easier to get off of it because it has a half calf. So
what do you recommend putting in your coffee
milk?
Or non-coffee coffee? Because I was just saying that one of the reasons I drink coffee is mostly for the cream and sugar.
Oh.
Or,
I use mocha mix. Or coconut milk. I'm out here on the West Coast. We have mocha mix, which is a non-dairy alternative because I don't use regular milk.
right.
And I also have a vanilla flavored coconut mix that I use with my frappuccinos sometimes.
I noticed that you don't recommend artificial sweeteners.
Yes.
Okay. What about artificial sweeteners like stevia or monk fruit?
If your body likes it, go for it.
Just depends on how it affects you.
Yeah. Yeah. I don't need, the cool thing about the Bella Rosa is it's not bitter at all. So you don't need to put sugar in this like you would a regular coffee. It has extracts of barley, rye, chicory root, dandelion root, and sugar beet.
Okay.
And so you're going to find that you're not going to need a sweetener for this.
Okay.
Dandy blend.
Okay.
Yeah.
So go to tea first, herbal tea first, then like to a Rubio's tea, then to the Dandy blend, and then if I want to keep going, go to like to Bella half.
Yeah, but
decaf coffee, low acid.
Yeah, but our challenge here is you're doing 4 cups of coffee a day. So the problem is you're going to get a blistering headache. So that's not going to work for you. I mean, you're really going to have to titrate down. So if you can go from 4 a day to 3 a day for several days, go to 2 a day for several days, try to go to 1 a day, or you can swap over and do 4 half calves a day. Mm-hmm. Which would prevent the headache, and then you can go to 3 half calves a day. It's gonna be a little bit of a challenge, but you're gonna get there. You're gonna get there, and you're gonna fall in love with Dandy Blend. I mean, there's just 0 acid in it, and you can flavor it however you want to flavor it. I think you'll really like it.
Use it, Mara.
So that should kind of help maybe calm the symptoms down, right?
Oh, hey, girl, 4 cups. If I were drinking 4 cups of coffee a day with estrogen atrophy, I'd be up all night and fairly out of my mind. I mean, that's brutal. That's brutal on a dry bladder.
I haven't been experiencing it so much at night. Is that when I'm awake during the day, I'm just so uncomfortable and so just miserable at times. I'm noticing, especially like if I'm at work or, it's just, I don't even know how to describe it other than miserable. It's not like I'm in excruciating pain. It's just this constant discomfort.
Okay. Where's the discomfort?
So I gather in the pelvic area.
Okay,
Where
but
the pelvic bone is.
okay, but where?
And I'm assuming it's the urethra where I urinate from.
Okay,
Those
so
are the two places that I'm really feeling it. It doesn't hurt when I pee. I pee just fine. You know, it's not. It's so weird to me. I don't understand.
does it feel like it's not emptying completely? Like there's a drop of urine stuck in your urethra that's not coming out? It's just annoyed. It's an annoyed urethra.
Yeah.
It's a annoyed. So, honey, that could be gone in a week with estrogen cream.
Okay.
I mean,
And
literally.
that makes sense because I'm going through all of these other symptoms of menopause. So I mean that totally.
Yeah, and just know that
I do have an appointment in my OBG on the 11th.
Good.
For pap smears, so I can talk to them about that.
Good. Yeah, I think that's reasonable. Let's see what they say about your skin. And you know, just get the menopause manifesto, watch the estrogen chat video on our website that I did several years ago, and that will get you where you need to go so that you have a really good constructive meeting with them. Just want her to look at your skin and let's see. But that, you know, again, the urethra is the canary in the coal mine when it comes to estrogen atrophy. Okay. All right, hon.
So much. All right, ladies.
See you, Mara.
All right. We're going to come to Jeannie. Jeannie, are you there? I'm trying to.
Okay, I'm here. I unmuted myself.
There you go. And how are you doing on this lovely Sunday?
A little better.
Okay.
I'm just going to give you a brief history. I've had IC for 3 years.
Okay.
It's gotten worse over time.
Okay.
I have pelvic floor driven, bladder wall driven, and the menopause one that you just mentioned.
Mm-hmm.
So I do take an estrogen and rub it all in there.
Okay.
I'm going to pelvic floor therapy. I just got the one so I can do it myself.
Okay.
I'm going this Friday to see Dr. Moldwin over in Long Island.
Nice.
It's about a 4-hour drive for me. My son's coming up from Maryland to take me there, which is really amazing. So I did go 2 months ago and saw his assistant. And one thing that I want to point out, if you've got pelvic floor driven IC, she recommended two warm baths a day for 15 minutes with Epsom salt. And that has really helped me.
Yeah.
Because what's happening is it really stings when I pee. And so I try to push it. My body just takes over and pushes.
Mm.
And she said that's an absolute no-no, but it's very hard to put into practice. I try to breathe through it, but it's like having a baby when they tell you not to push.
Right.
So she wasn't sure, but that burning and stinging as I pee, could you comment on that at all? Or
well, again, how old are you, hon?
63.
Okay, so your urethra is dry. It's drier now. And so if we use our model here, right, and we get you to the point where you're here, you don't have, here, let's see. So you don't have as much mucus as you used to have. When urine is passing along this tissue, it's stinging. There's ammonia in your urine. There's urea in your urine. Your urine is irritating. And if it's crossing dry skin, it's going to trigger symptoms. It is what it is. So you're at your age, you're dry. The question is how dry. That's the challenge. Is we need to know.
I'm using the cream twice a week, and I put it, in my vagina and on my urethra.
Okay. And so they need to look at your skin and see if that's enough. It might not be enough. Maybe they might suggest that you do it 3 times a week. I don't know. You'll have to let them look.
Okay.
Yeah. So, I mean, when I was going through my urethral issues, it was all day, every day for 3 months. And I threw every self-help tip I knew in the book. I mean, that I knew. I threw the book at it. Nothing worked, and I threw myself on the mercy of my urologist and said, "Please help me understand why this is hurting so much." And he was like, "Jill, didn't you use the estrogen cream I prescribed for you last year?" And I went, "No." He goes, "Why?" And I said, "Because in my brain, I'm 25 years old and I can't possibly have an age-related issue." And he goes, "I wouldn't have given it to you if I didn't already see this coming. This was coming." And I was 51. And this is way before I had my hysterectomy. So, you're there. You're there.
Yeah, I've been using that cream for years now.
Okay. But then the other thing we have to think about is there something on a daily basis that you're doing that is provoking that skin, like drinking coffee, because the skin, or do you take a multivitamin? Do you, are you following the IC diet?
Yep.
Are you taking any unusual supplements or protein drinks or anything like that?
No, I just started the Peora.
Okay, good. The Peora is a good. I personally like the Peora. That's what I'm taking. I mean, I think it's keeping my nervous system as calm as it can be until I tweak it. So I let's just let them look at your skin and see if that's enough. Okay.
And he'd be able to tell me, the doctor in Long Island?
Oh yeah, he should. And then the other question really is, when you went to physical therapy for the first time, what did they find with you? Were you tight? What did they find?
Yes.
Okay. And so
they found I was tight, especially like on one side, and that's where the sharp pain is, on that one side.
Exactly. And for me, I'm tight on my left side. That's where my sharp pain is, on my left side, which I had earlier, which is why I was stretching. So then the other question that you have to ask the physical therapist is, are you improving? Are the muscles slowly improving, or are they staying in tension no matter what she does? And if they are staying in tension, then that's when we have to try to figure out what else could be putting pressure on those muscles. And usually it's going to be a bad hip, a bad SI joint, a bad knee, or a bad foot. That there's something on a skeletal basis that is putting long-term chronic tension on those muscles, or forcing those muscles to stay in tension. Right? That's,
I get a little looser when I'm doing it, but not to the point where I'm relieved all the way. So that is a good point.
I mean, it's challenging because, again, for me, it's my left SI joint, and my left SI joint is just messed up. And I go through periods where my muscles are in good shape, and then I go through periods where I'm dealing with levator spasms, and that's what it's going to be until I can get my joint stabilized. It's just COVID has prevented that. So there's a bit of a frustration that I can't do something. All I can do is work to keep my muscles calm and collected, knowing that right now I am predisposed to being tight. And that means using that wand daily. I would love to be able to take baths twice a day, but unfortunately I'm dealing with incontinence. I'm dealing with incontinence. Here, hold on a second.
I go 25 times in 24 hours.
Yeah. Well, that's definitely up there. I was just to finish what I was saying. I can't use my bathtub safely because I have family members who are dealing with incontinence, and we have to wash them in there. So I would love to be able to take baths twice a day. I really think that it would absolutely help my levator muscles. So I would keep doing that. But then again, when you're working with your physical therapist, please ask about the progress you're making. And if you're not making progress, get them to look at your bones and see if they can figure out why your muscles are staying in tension. Okay. And there's a very good book. I am in love with this book. I am in love with this author, Breaking Through Chronic Pelvic Pain by Dr. Jerome Weiss. And he is the one who's really helping us understand those patients who are in chronic tension. And those patients who have nerve issues because they're in chronic tension. Believe me, I have nerve issues down there. This book is free on Kindle Unlimited.
Oh, wow. Okay.
Breaking Through Chronic Pain, a holistic approach to relief. So think about this too, okay? It will.
I've had it in my IEC cot for a while.
Yeah,
I haven't pushed it.
I mean, and it just like things like it goes over the different muscle groups, where you get the trigger points. Oh,
yeah, because pushing, before I knew not to push, I would push my urine out.
Yeah.
And I've actually caused bleeding that way.
Oh, yeah. Yeah. You know, things really get messed up. No doubt about that. So, all right, hon. Well, listen, I'm very hopeful for you. There's nothing about your case that is alarming to, you know, you're not peeing blood right now. You don't have fever. Your pain level isn't off the charts. You've got some frequency. And again, you know, we always have to look at the quality and health of the skin in women whose symptoms, where it begins as they get older. That's really the very first thing. We call this the genitourinary syndrome of menopause. Of course, if you fell, you could have hurt your pelvic floor muscles. That could have been a trigger. There are other things which could be triggers, but that would certainly be the very first thing that we would be looking at. Okay.
Okay. And I love the BladderTracker. I'm using that.
Are you good? Good. Yeah. Hey, listen, give us some feedback in whatever store you were in, because we're having some login issues with some people. Some people are having trouble registering. We don't know why. About 6 people so far have emailed me. So we're trying to figure that out. But I'm really glad that BladderTracker is working for you. And for those who
it's working great.
Yeah, for those who don't know what that is a free application that we launched last week with Natural Approach Nutrition. Amazing company, really cares about people. We invested tens of thousands of dollars building this for a free app. That company did it and we did it. And so for anybody who wants to track their symptoms, just go to your Google Play Store or your your Apple Store, and it will track pain. It will track your treatments. It will track your food, your water, your hydration, etc. Great. It's a great app. So, all right, guys. Well, listen, thank you for the Zoom. It's time to go.
Hey, Jill.
Yeah.
Guess what? I got something for you. Guess what?
What?
I got something for you. I don't know if you've ever addressed this before.
Okay.
Okay. Let's just talk. And if you have, stop me.
Okay.
You know how you have frequency and urgency?
Yeah.
I can go through the entire day and go 2-3 hours without even urinating.
Mm-hmm.
Are you with me? I know about the endorphins and all of that, right?
Yeah.
I can go 2-3 hours, don't even think about it. 10 o'clock comes, boom, like clockwork. I gotta go to the bathroom. Okay.
Okay.
Now, I have tried sleep. I don't know what you call it, like NyQuil.
Yeah.
That I've tried to take things that will help me sleep, get into a deeper sleep better.
Yeah.
Do you believe? And I don't know, and maybe someone has addressed this. I don't know that anyone has. I want to address it with you. Okay?
Okay.
Just as a side note. Do you believe that if we get into a deeper sleep, that would help the frequency and urgency of urination at night?
Well,
and I say, and I can send you 2 things that I've tried. One has been NyQuil. I want everyone to know this. I'm not afraid. One has been NyQuil because it's not habit for me, and the other one was a Prima. I don't have it with me. I can get it for you. I can send it to you through an email. But I've tried. It says you take 2 at night, and I've increased my magnesium. And I've tried to get into a deeper sleep where it turns off. Correct me now. I don't know if what I'm saying is correct. It turns off the nerves or put you into a deeper sleep where the nerves that would normally turn on to cause you to go to the bathroom cuts off.
Yeah.
Am I making any sense to you?
Well, I think I understand what you're saying. What you're saying is that you're pretty good during the day. You're only peeing every 2 or 3 hours. But come the magic hour of 10 o'clock, that's when it starts.
Yes.
And that's when, and then you're going to have hours and hours where you're dealing with more frequency.
Amen.
So I just read an article on this, and I'm going to have to try to dig that. I don't. It gave a couple of reasons why that happens.
No worries.
That there's like a biological explanation for that happening in some people. I just don't remember what it is off the top of my head.
Worries.
So I will try to find that for you.
Sleep. I was thinking, if I put myself, you know how your brain just keeps going and going and going, and you don't get into that
REM sleep
that you really need to get into. So
there's no doubt that the body heals best with REM sleep. That's when healing happens. And so the fact that we are in REM deprivation is never good for us. You know, we're missing key parts of that normal daily tissue repair and body healing that normally happens at night that is not happening for us at night. For some of us at night. So it's probably on my other computer. I swear I read it in the last 2 weeks.
I just wanted to challenge you.
I will look for it.
It's IC Awareness Month.
Thank you.
Challenged by Jilly. I was thinking, this is what I'm trying. And for all of the IC family out there, these are just what I try. I do my research. I do organic. I try to do what I can. But once I start researching, I start thinking, maybe my brain is so active that I'm not getting into REM sleep that puts my body into a place where you're not dealing with getting up and going to the bathroom. You know, it doesn't trigger what I don't know, Jill. See, that's what I'm saying. I think no.
Okay, so it's very important that you establish a routine. So as an example, like in my second year with IC, when my pain was so crazy, and this was before the internet. We didn't have the internet back there. What we had on it was a books on tape store. And at the books on tape store, the lady who I used to go in there, and I would be my crying, miserable self, and she would give me stuff. And she gave me a book on relaxation. So I was having trouble sleeping too. It was Potentials Unlimited, Barry Konikoff, relaxation something. And I still have it somewhere in my, do I even have it here? Hold on. I have all these CDs. Anyway, so yeah. Oh no, that's not it. Is that it?
I'm back.
Nope, that's not it. Okay, so anyway, it basically, there were two parts to it. Part of it was a guided relaxation, and the other part of it was a subliminal guided relaxation that you turned on at night. And I swear, within a week, within a week, I had trained my body to go to sleep. As soon as I heard his voice, I fell asleep.
Yep.
And that was my go-to for about 10 years, was Barry Konikoff's Potentials Unlimited. And it was a guided relaxation for healing. I think that was the name. And now I don't do that now. What I do now is because I have tinnitus, my ears ring, and that keeps me up at night. So I always have a book on tape running all night long. And I sleep so good. I'm usually asleep within 5 minutes once I turn my book on. And the best books on tapes are the Harry Potter books, you know. I mean, the happy fun books that are fine anyway. The Diana Gabaldon Outlander books, any of those books where they're happy memories for you. I just have them on in the background, and I'm usually really good. I just went through all the Harry Potter stuff again. And then I sometimes I'd even just turn the movie on. If I just turn the movie on my iPad, I'd be asleep before the credits. Before the opening credits were done. So think about that. Think about having a nice routine. All right. So Donna has left the screen. Where did she go? All right. Facebook and YouTube, we're going to be coming back to you again very, very quickly.
Can I say something, Jill?
Of course.
In answer to the other woman's question, I'm taking hydroxyzine, 75 milligrams.
Yeah.
So I get into that deep sleep, but the pain still wakes me up 11 times a night.
Interesting.
You know, and I have to go.
Yeah.
But I can tell, like, sometimes it's a light sleep and I can walk to the bathroom easier. Other times I am so groggy that the pain will wake me up to have to go.
See, and that's where, with your case, it would be a very interesting experiment to try Bladder Builder, something like Bladder Builder that has the chondroitin and all the things to protect the bladder wall combined with the PEA for pain relief. And so,
okay, maybe I'll try that after the PEA.
Yeah, the Bladder Builder. Well, so this has Peora in it, right?
Okay.
And so the Peora is just for the nerves. There's nothing in the Peora that's going to help your bladder wall. But at your age, with the estrogen atrophy, you having something that, like chondroitin that might help, give your bladder a little bit of an extra coating, that's really going to be your priority, is something that can protect the bladder wall a little bit more. So Bladder Builder might be very, very interesting. All right.
Okay.
All right, you guys. Sierra has a question, then we got to go after Sierra's done. Okay. Let's see. Hold on.
Jill.
All right, hon. You're the last one. What's going on? Do you have one more question?
Yes, I took the hydroxyzine too, but I don't see a difference in my bladder. You're the last one. What's going on? Do you have one more question?
Oh, see, we're getting a repeat from somebody. Donna, honey, I'm going to mute your microphone. Jeannie, I'm going to mute your microphone here because somebody's got some feedback there. Hydroxyzine is an antihistamine that has a beneficial side effect of maybe reducing some anxiety and helping with sleep. But fundamentally, it is an antihistamine. And so we're not going to expect it, to make an immediate difference. It's about taking a little bit over time, you take a little bit every day over time, hoping that over time it will help reduce and calm some of that inflammation and irritation that's happening in your bladder.
I was on it for years.
Yeah, I took it for about 10 years myself. Well, listen, if it didn't work, it didn't work. And that kind of makes sense since you're doing well with pelvic floor physical therapy. Maybe going back all those years, it really wasn't so much a bladder issue for you. Maybe it was a pelvic floor issue for you all along. And so this is very exciting that you're now doing another therapy that really has the potential of helping you. So I'm very, very happy for you.
Okay.
All right. Okay, guys, to everybody on Zoom, thank you for your love and for your questions and for having my back and supporting me for those moments when I need support. And God knows that, the next couple of years are going to be challenging. I am going to be dealing with losing my parents sooner rather than later. So
hey, girl,
I need love.
Don't even think about that.
Oh, I'm not.
Enjoy them. Just enjoy them.
You better believe it.
And it was me. I'm so sorry. It was me. I lost the connection, and I'm so sorry.
Oh, no, it's okay. It's okay.
I didn't mean to do that, and I didn't mean to mess things up.
You're fine.
I wanted to do.
You didn't. You didn't. You're fine.
Honest to God. I just wanted to tell you I love you. I don't care. You don't even have to have the last word. I'm not going to have the last word. You're going to have the last word. I just want to tell you.
All right.
I feel awareness month.
All right.
Hey, it's the awareness.
Yeah.
And you know what, guys? We're going to do it, aren't we? We're going to do it for Jill. We're going to do it for ourselves.
You better believe it. Yeah.
We're going to have a good time. And you know what? No matter what kind of pain we're in, we're going to get through it. Jill, I love you.
Thank you.
Thank you. Thank you so much for all that you do.
You're a sweetie. Thank you.
I emailed you my email address?
Yes, I got it, honey. I got it. I'll see what I can do. Okay, guys, I got to shut down Zoom.
Hey, you know what, Jill?
Oh, yeah.
I got it. I'm sending it to you. You
okay.
know what I'm saying?
Okay. You have my home address. Send it to my home address rather than sending it to my warehouse so I'll know what it's for. Okay. Okay.
That's my contribution to IC Awareness Month. And you know what? We all deserve that because not everybody can afford everything. I'm not saying I'm a rich girl. I'm not. But you know what? $30 is better than nothing.
Well, and
Jill,
listen,
I love you.
For anybody who's bought IC 101, if you have not found it helpful, I will buy it back from you because I have a ton of patients that I can give it to. So, all right, I got to shut down Zoom. Bye, everybody on Zoom. All right, Zoom is now shut down. No, I don't want to update. Okay, I just got to do this. I got to do this. I got to do this. All right, now I'm back. Woo! Okay. All right, so now I am back. I know I missed questions here, you guys. Anne says, I know what you mean at night with frequency urgency. And so if you should like that article. Yeah, I will try to find that article. I know I was fascinated by it. I was absolutely fascinated by some of the more arcane biology that happens at night with urination. Sue said, preparing to get a steroid shot and a nerve bundle in my spine. Totally desperate. Fingers crossed. Girl, I had one of those done, I'm going to say last March. And it was super easy to do. Like I was just like, oh, worried about it. And oh my God. I mean, like they did it in 5 minutes. I didn't have to change clothes. You just, they basically, you just wear your joggers or whatever. And they just lift your shirt or lower your pants to create a field of vision. They will then sterilize it, with betadine or whatever they're using. They'll take an x-ray so they'll know what they're doing. So you're basically laying on an x-ray table. And the shot itself is just like 3 seconds. It's really fast. I was stunned. You're not supposed to, you do not assume that you can be able to drive home. I certainly wouldn't have had any problems driving home. But sometimes when you have a steroid shot in your back, it might make it hard for you to walk. So they always want you to have somebody with you to drive. I did not, I cannot say that the steroid shot helped me with my 2 ruptured discs. I do have 2 ruptured discs from last December. My back hurt more in the 6 weeks, but it was a different type of pain. It was the pain from the steroid. The steroid itself is a little bit irritating, but I have to say that my leg is stronger now. And so I do think it helped. In the long run, I do. So my challenge is that it feels like there's a tight belt around my thigh on my right side, which he says is a femoral nerve injury because I fell down in my garage. I didn't know that I ruptured disc in my back and I fell on my right leg in December and it gave out. And we think the fall actually damaged my femoral nerve. So it's slowly healing, but I have to wear a compression brace on my knee right now. Karen says, I have SI joint issues on my right side. What is the, and that is the worst side? Yeah, ditto. Except mine's on my left side. What do you use to help that? I can't sit in the tub because of my back issues. An SI belt, hun. Do you have an SI belt? Do you know what an SI belt is? Let me go get one. Hold on. So, you guys, the SI joint is the this is the SI joint. It's the joint that connects your hip bone to your sacrum. From the front side, you can see that's your SI joint right there. This joint is meant to not move. It's meant to be very, very stable, obviously, because look at it, it basically holds everything together. But for some of us, it starts to move. And so usually what they will first recommend is something called an SI belt. And when they finally figured out it was my SI joint, they told me to get a belt. and you wear it low. You see that it's not up by my waist. This is my waist. My SI joint's down here. And so you would, sorry, it's my COVID stomach. It is what it is. No apologies. You would wear it like this, and that would help to stabilize that SI joint. Then it's about physical therapy that are working on strengthening those muscles that normally help to keep that joint together. But you can get this on Amazon. This is by Serola, Serola. I don't know if you can see that. Serola. So that would be what I would try, Karen, is I would try an SI belt and see if that helps. I mean, literally, as soon as I put it on, the pain improved like 80%. And now my muscles are much better. And so it's holding my joint together much better. But my joint, the ligaments, or it's either a ligament or it's a ligament that is involved with holding that joint together, is just too loose. So they want to do prolotherapy, where you inject an irritant into the ligament, and that forces the ligament to kind of heal itself. And I also want to do that on my jaw, because my ligament right here, because of my SI problem, I was laying up, I couldn't sleep on my back, and I couldn't sleep on my side. I can now, I couldn't then. I would sleep on my stomach, and I would sleep like this with my pillow here, so that my SI joint was being protected. But what happened is it stretched the ligament out here. The worst thing to do if you have TMJ is to sleep on your stomach. And so, so now, I mean, it's just constantly an issue. This joint's very, very weak. John says, what supplement might help with central sensitization? Peora, Peaora, is the supplement that is really focusing on calming nerves down. That's what I take. Anne says, you have to use estrogen. My applicator does not say 0.5 grams. How do I figure it out? Your applicator doesn't say, but does it say 1 gram? Just do half of 1. Let me go get one. Hold on. I always have a little thing of applicators. So here is the applicator. Whoops. This is an applicator for the estrogen that comes with me. I have a whole box of them. And so the way this works is you screw the estrogen onto this end, and then you pull it this way, right? And so this one has a mark of 0.5 and a mark of 1 and a mark of 2. And so based upon your prescription, what the doctor wants you to do, that's where you would see the marks as you pull it out. Okay. Always wash it. Thank you, Donna. You always, always, always wash it in hot water. I only, ask for more than one. It's always good to have backups, especially if it falls on the floor, then you probably want to throw it away. All right. Becky says, I've managed over years. I've had years with no symptoms and years with more flares. And, see, Becky, that's why this supports the IC, for some people, an IC model of injury rather than disease, right? I mean, because your bladder can be injured. If you are IC subtype 2 bladder wall driven, your bladder wall could be injured by chemicals like diet soda, or like chemotherapy or ketamine. And then you eliminate the irritant, the bladder heals, you go into remission, but then 2 years later, 3 years later, the bladder wall gets injured again. Or we could say the same for muscles, that the muscles were injured, they healed, and then they got injured again. Karen says, I don't get enough sleep. And yeah. Anne says, where do you get the extra things? Just from your pharmacist, whoever gave it to you. Just go back to the pharmacist. They should just give them out to you. If they want to charge you 50 cents for it, that's fine. I get mine from the Women's International Pharmacy, and they always send extra if I ask for them. Chip says, I've been going to physical therapy for 2 months, not seeing any improvements. How long does it take to see improvements? My therapist admits she doesn't know everything, and she suggests that I could try another therapist. The only problem is I would have to travel 4 hours away. Yeah, and the travel kind of defeats the purpose, because when you're traveling with tight pelvic floor muscles, the odds are you might go into a spasm just because you're sitting in the car. Let me open up my database. I have a database of physical therapists and urologists and stuff who work with pelvic floor. Why don't we, normally at the end of these meetings, if somebody looking for a referral, just tell me where you're located and I can look it up for you, Chip, if you're still here. Anybody looking for any referrals? And Vanna says, have your symptoms worsened, become better if you manage them? My symptoms have definitely gotten better. I don't live with severe pain anymore. It's really rare. It's like really rare. But I am the queen of sensitivity. Vanna says, I'm 34. Is it unusual to have IC at a younger age? Honey, we work with people who are 5 years old, 6 years old, 7 years old. You can be injured at any time. Remember, we don't think of IC as an incurable bladder disease anymore. We think of it as a pelvic pain syndrome. Why? Because structures outside of the bladder are often involved, if not the cause. And in children, we can see traumatic injuries, falling down, falling on their tailbone, especially if they're in gymnastics or ice skating or playing football. So we see muscle injuries in children. We see bony structure injuries in children who've been hit by cars, have pelvic damage there. Or there can be some inheritance, redhead, being super sensitive runs in our family. And so we can have sensitivity at a young age that, we can track over time. I'm definitely, as I've gotten older, I've gotten more sensitive. Vanna says, recently my pain in my back is radiating down into my legs and I'm struggling to walk. Any tips? Well, yeah, they got to work on your back. Whatever's going on, work on your muscle strength. But it's hard when you have a back issue because you don't want to do something that could exacerbate that. So that's where you really have to work with a physical therapist who knows what your back issue is so that you're not doing things that could hurt your back. Like I was told, I've had to work really hard now at bending my legs much more, picking stuff up. I have really long arms and legs. It's really normal for me to just bend over and pick stuff up. And I can't do that anymore because I'm trying to protect these ruptured discs in my back. So you need some clarity and some guidance from an expert physical therapist or your doctor so that you're not accidentally doing that thing which could make your back worse, right? So what my physiatrist said is, pretend you have a pen in your pocket, if the old days when we had pockets where we wore pens. If you're bending over so far that the pen would fall out of your pocket, that's too far. Zelda said, you referred me to Dr. Day at Mass General, and I'm going to see her in December. Awesome. I think you're going to love her. I was working with another one of her patients last week, as a matter of fact. Okay, so Anne is looking for, let's see. Chip says, St. George, Utah. Hold on, let me go to Utah here. St. George is busy. That's if I have to move from California because of fires and stuff, it would probably be to Utah. I would prefer to stay So the only urologist on this is at the University of Utah in South Jordan. I know, St. George, you're down by the border, and it would suck for you to have to. Are you close to South Jordan, Utah? See if I have any physical therapists. I got Eagle Mountain, Utah, Murray, Utah, Murray, Utah, Murray, Utah, Riverton, Utah, Salt Lake City, which I know is too far, and South Jordan, Utah. Are any of those close? South Jordan, Utah. I don't even know where that is. Okay, and Ann's looking for New Jersey. Here, hold on a sec. Let me just get a map real quick. Is Chip, is South Jordan, Utah close? Let me look at a map of Utah real quick. It's in South Central. Okay, that's promising. Oh yeah, man, that's not too far. Well, oh, no, it is crap. Where is Murray, Utah? Let's see. That's too far. How about Eagle Mountain, Utah? EAGL, Eagle Mountain, Utah. Oh, yeah. You know, oh, I'm sorry, hon. I'm sorry, Chip. That's rough. I mean, Vegas is 2 hours away. Let's look at Vegas, just out of curiosity. And then we'll go to New Jersey for Ann. There's no urologist listed in Utah. I mean, in Las Vegas. Darn it. Pain management doctors in Las Vegas, several. Las Vegas Pain Center, Nevada Pain Center, Desert Orthopedic Center, and Vegas Physical Therapy, Summerlin Pelvic Physical Therapy, Select Physical Therapy are going to be your best choices. All right, let's go to New Jersey for Ann. You're looking for a urologist? You've got New Jersey Urology in Mount Laurel, Dr. William Niedrak. You've got New Jersey Urology with offices in Sewell, New Jersey, and Voorhees, New Jersey. That's Dr. Bhutani. And then you've got Bordenton, New Jersey, Mount Laurel, New Jersey, and Willingbird, New Jersey. That is Scott Asroff at New Jersey Urology with a focus on pelvic floor disorders. Those are urologists. Teresa says, still looking to find a good replacement for Elmeron. Any suggestions on what you have tried that works? So with the Elmeron, there's no other FDA-approved medication on the market that has a bladder coating effect like the Elmeron does. You could either go to Elmeron installations where they put the Elmeron in your bladder, where it is believed not to cross the skin into the blood vessels to reach the eyes to any great degree, although that hasn't been proven in research that I'm aware of. So generally what people have been doing is they have been going over to the chondroitin-based supplements like the Bladder Builders. You know, Bladder Builder is our top supplement right now, in my opinion, because it has the most methods of action. It's got chondroitin for the bladder wall. It's got quercetin as an antihistamine. It's got collagen in it, L-carnosine, L-citrulline. It's got some beneficial probiotics in it. And most importantly, it has PEA in it, which we know from research has reduced pain. It is a very aggressive formula. If you take probiotics, then we would not suggest this because this does have probiotics in there. Some patients flare from probiotics because of a histamine sensitivity. So if you're one of those patients, then it would be Bladder Rest, Cystoprotect, or Cystomend would be the other options. None of those have PEA in it to reduce pain, though. You could always take the PEA in it separately if you wanted. Karen said you had 3 rounds of prolotherapy. It did help. Karen, so my doctor said it was very bloody. He warned me. He said if we do it, it's very bloody. So was the prolotherapy hard? Jenny says, what about urethra pain? So, Jenny, I have a blog, an article on our website, or a blog on our website, the 7 causes of urethral pain. So let's just go through those really, really quickly. Number 1, UTI. So most IC patients with bladder wall issues, IC subtype 1, subtype 2, do not have a lot of urethral pain. We just don't. So that's one of the things that separates a bladder wall flare from a UTI, is that the bladder wall flare doesn't usually cause a lot of urethral pain, whereas the UTI does. So bladder infection would be one of the things we would want to rule out first. The second thing is estrogen atrophy. If you are on birth control, if you've gone through surgical hysterectomy, surgical menopause, chemical menopause for endometriosis, your bladder needs estrogen to produce mucus. And when we lose that source of mucus through chemicals or aging, the urethra starts to get dry. And so the urethra is kind of like the canary in the coal mine when it comes to estrogen atrophy. We would want to look at pelvic floor tension. The pelvic floor muscles can get very, very tight. And when they get tight, that can squeeze the urethra and cause pain. You can see here are your levator ani muscles. Here's your urethra. So if these muscles around here are super, super tight, they're going to squeeze the urethra. That can cause pain. We're going to look at chemical sensitivity. The urethra can be quite sensitive to chemicals. So in mini pads, if you wear pads and you notice that you get more pain when you wear a pad, that's quite common. Or if you've changed detergent recently, I mean, if I put on a pair of underwear washed and tied, I will have urethral pain and vulvar pain within 5 or 10 minutes. There's just a chemical in that my body absolutely hates. You have to be really careful with fabric softener. Anything that leaves a smell in your underwear can also leave a chemical in there that can irritate the urethra. And then there is a little gland up the urethra. So your urethra is about the size of your little finger. And about halfway up is a little sea sponge-like gland on the outside that is called the paraurethral gland in women. It is what we call a homologue to the male prostate. That is, when you look at it under a microscope, it looks identical to a male prostate in terms of cell structure and stuff like that. So women, guess what? We have a prostate. And like the male prostate, our female prostate can easily get infected and blocked. The drainage ducts in the paraurethral gland are absolutely tiny. And so they are known for getting blocked. And it basically begins to feel like a pimple, like a deep pimple. But you can tell if you have this because, let's see. Okay, so again, so here is your levator, right? And so this is an example of all the muscle structures in the lowest part of your pelvic floor. So again, we have the urethra, we have the vagina, and we have the rectum. So if you had a periurethral gland infection, it would basically be about an inch up. So what you could do is you could wash your hands, or if you have a glove, you can use your finger, stick your finger up your vagina about an inch, and then just rub the front side where your bladder would be. Just gently touch. And again, it's not far, it's like an inch. And if you feel what feels like a deep pimple, it's like, you know how everybody's had it at one point in time. You have a pimple that's like on a nerve and it just won't come out. And it's like, oh my God, this pimple needs to go away. And it just sits there because it's not draining. That's exactly what these periurethral gland infections feel like. They feel like a deep pimple. So again, if sex is painful, if putting, if the act of penetration is painful because the penis is pushing over this infected gland, that's one sign that you could have an infected gland. Or if you touch it and you can feel, if you feel a lump, a small lump, like the consistency of a pea, that could also be an infection in that gland. So come on over to our website and just Google urethra, and you can read that article in depth and go over that stuff. Joni says, can you please give my email out? Yes, my email is icnetwork@mac, M as in Mary, A as in Apple, C as in Charlie.com. That's short for Macintosh computer, because I'm working in front of 2 Macintosh computers right now. I'm an Apple girl. All right, my friends. Well, listen, my little elevators say I am done sitting. And so I think it is time to call it. It is 4 o'clock. We have been doing this for 3 hours and 7 minutes. If you find these helpful, please come on over to our website and become a member. If you become a member of the IC Network, you get our magazine, the IC Optimist. We do this quarterly. And there are much bigger, more in-depth articles in this magazine that you're not going to find on our website. And this is really one way that we support these meetings. But obviously they're free. Our website is free. We understand that that's not possible for everybody. So anyway, it is what it is. I wish you well. Here's your homework. For 15 minutes a day, I need you to do something that will nourish your soul. For me, after this meeting, it's going to be going out and walking and talking to my best friend on the phone. For 15 minutes a day, I need you to do something for your bladder or your pelvic floor. So please get down on the ground and do whatever exercises your physical therapist told you to do. For 15 minutes a day, I need you to improve your knowledge. Come on, you can read 1 article a day. You can read 1 blog a day. Facebook is not where you should be getting your information. You need to be reading real information too. I was really shocked last week. So somebody sent me a link to a Facebook group, and they were debating my face. We think, they didn't know anything about me. Who is Jill Osborne? They went, well, I just don't trust her by the way she looks. And it's like, what the hell is that all about? And I actually chimed in and said, so you're gonna base your perception of me by the fact that I have red hair and not by what I do, what I've done? That's how low we've gotten in the internet, guys. Come on now. So anyway, you got to read. And I built the IC Network credible to give you credible, good information. It was rated number 1 by Harvard Medical School and the University of London in England. We have been the top IC website in every study that's done. I don't know if there's any new studies that are done, but I'm pretty proud of that. So I think you can rely on that info. But ultimately, in the end, this is about you learning as much as you can and me kicking you in the butt and getting you back to your doctors and asking questions. Because it's not my job to give you medical advice. It's my job to just try to open up some new doors. And it's your job to go explore those doors and learn about them and figure out if I'm getting it right or I'm getting it wrong. I'm not perfect. I'm going to make mistakes. That's okay. You're going to make mistakes too. That's okay too. But hopefully together we can all get you in a better situation. Karen says, no, having prolotherapy was not bad. The injection would cause irritation, but no more so than the steroid injection does. And then over several weeks, healing can occur because the irritation is signaling the body to go there. Did they do it with a needle? Obviously, they did it with a needle, right? I mean, was it fast? I mean, my physiatrist, he said he'd only done a couple in his career, and he was like, I don't know if I'm the one who should do it for you. I know I want it done. So I would assume that it's in the same room that they do the steroid injection for your back, and that they're still using an X-ray, probably. And they're just injecting the steroid or whatever it is into the ligament instead of into the spine. Karen, if you could email me your experience, I'd love to hear how that went for you. I would love to hear how, I mean, because I'm caring for elderly parents, and I can't really be down because I've got no backup. So I don't have anybody who can step in and help right now. So, all right, my guys, be well. And I will see you again, Facebook. Hopefully I will do another live stream on Thursday just for you. And we're working on lots of new projects. And oh my goodness gracious, life is very busy right now. Okay, I'll see you later. Everybody, you be good. I wish you well. Giant hugs.